You do record.
ఇది పెట్టుకోవాలి, ఈ రాశి వాళ్ళే ఇది పెట్టుకోవాలి అనేది ఉండదు.
ಇದೆಲ್ಲ ಇಲ್ಲಿ ಸಾವಿರ ಮಟನ್ ಆಗ ಹೋಯ್ತ
ಮಾಡಿಸಿದಿ
ಸರ್ ಇದೆಲ್ಲ ಫೈಲ್ಗಳೆಲ್ಲ ಮಾಡ್ತಾರೆ.
ಏನ್ ಬಿಟ್ರೆ ನಾವು ಫೈಲ್ ಎಲ್ಲ ಇನ್ನೊಂದ್ ಕೊಟ್ಟೋಗತ್ತಾನ ನೀ ಹೇಳ್ಬೇಕಾಯ್ತು ಈಗಿಂದ ಏನ್ ಮುಂದೆ ನಾ ಮಾಡ್ತೀನಿ. ಹಾ
Good afternoon, all. Sir, first of all, welcome to our keynote speaker, Dr. Damodar Reddy Garu, today's session expert. Sorry for due to some technical issues, we are unable to start it in the right time, so it is delayed by 15 minutes. Sorry for the delay. Sir, Damodar Reddy sir, is there, sir?
Yes, sir, I can hear you.
Can you turn on your video, sir?
One second.
దాని కొంచెం మాట్లాడకుండా turn on your video. Oh,
Yes, it's visible, sir,
yes.
now?
Yes, sir, visible, sir. Thank you very much, sir. Sir, I would like to give some brief introduction about today's keynote speaker for the FDP AI Innovations in Healthcare and Medical Technology. So, Dr. Damodar Reddy Edla Garu, Associate Professor, Department of Computer Science and Engineering in National Institute of Technology in Goa. His research interests are artificial intelligence, cognitive neuroscience, brain-computer interface, medical imaging, wireless sensor networks, machine learning, deep learning, Internet of Things, which are aligned with our FDP title. So regarding SAR has published various articles in standard journals like Elsewhere, IEEE, Springer. He had a very good publication track record. There are so much of list is there. Had very good research in biomedical signal processing as well as in sensor networks. Regarding funded projects, are had funding projects. In that one is Indo-Navian collaboration in intelligent offshore mechatronics system. Research Council of Norway under INTPART. Its budget is around 4 crores. It's very good achievement, sir. And one more another funding project is designing efficient algebraic activation functions in deep learning for classification of EEG data, which is aligned with our topic, which is funded by DST SERB. Budget is 6.6 lakhs. Next, another funding project is secure and dynamic privacy preserving public auditing schemes for IoT enabled data in clouds. funded by PMU Cybersecurity Center. Budget is 6,000 US dollars. Another funding project is modeling and simulation of brain-computer interface for implanted neural prosthetic devices using spiking neural networks and bio-inspired optimization algorithms. Funding agency is ARTPARK, IISc Bangalore. And another title is Energy Efficiency Optimization Using Machine Learning in Intelligence Reflecting Surface Aided Unmanned Aerial Vehicle for 6G Wireless Communication Networks, funding by DST Feb. The budget is 18.3 lakhs. It's a really very good achievement, sir. And regarding awards and honors, is the CSIR Senior Research Fellowship, that is one award. Young Faculty Award 2015, he received in 2015. Next, Dr. APJ Abdul Kalam Lifetime Achievement National Award recipient in 2018. Is the recipient of Best Researcher Award 2018. Next, another one is Distinguished Faculty Asia Arab Award 2018. MHRD Gate 2006 and 2007. Visiting Researcher at St. Mary's University, Canada. Chartered Engineer, the Institute of Engineers, India. Elsewhere, Outstanding Reviewer. IEEE Senior Member. 2020 IEEE TIM Outstanding Reviewer. Like that, sir had lot of awards and many more. So we are really blessed to have such a wonderful personality to accept our invitation. And today is here with us to give his presentation. Thank you very much, sir. I request Dr. Reddy garu to start his presentation.
Fine. Thank you. Thank you, sir. Thanks for the introduction. I'm sharing the slides now. Let me know once it is shared. So please check whether can you see the slide?
Sir, it is visible.
Yes. So very good afternoon, everyone. In this session, we're going to talk about the various applications of artificial intelligence towards the healthcare and medicine, and particularly in the direction of drug discovery. Before we start, I would like to request you to please be interactive and happy to share your, share my experience and take your questions if any. Please feel free to ask any questions in case you have any, and be interactive. So to begin with, what is the need of artificial intelligence for drug discovery? Because nowadays we are talking about the intervention of artificial intelligence everywhere. AI into some domain, AI into some other domain, XYZ. Everywhere we are talking about artificial intelligence and machine learning models. What is the need and significance of AI techniques for drug discovery? And eventually, when we talk about the applications of drug discovery or the problem of drug discovery, the main challenge here is, as we can see, drug discovery is very long-lasting process and very stringent procedures, protocols to follow. And when we talk about the concept of machine learning and artificial intelligence, something like a deep learning or some bio-inspired optimization algorithms, because when we talk about lot of simulations are needed when we uh, validate and perform the clinical trials in order to form a specific or in order to identify a specific drug See, drug discovery, it refers to a lot of things. So when we talk about what type of hierarchy of events are, you can see the protocols we need to follow to uh, make the discovery of a specific type of drug, and how do we perform various testing processes, and how do we validate clinically, and how do we make a lot of optimization in the process of discovering a specific type of drug for a certain type of diseases. So it is very very time consuming process. Certainly when we try to involve the artificial intelligence technique for such a concept, it will be leading to a lot of advantages in the process of drug discovery, and eventually at the time of validation of that. So what is like a first of all, what is the role of artificial intelligence in pharma when we refer? Like if you can see, AI is going everywhere, and why not pharmaceutical development or related applications? Now, when it comes to this domain, how do we use AI in pharma? Most of the questions when it comes, I would say simply I would give some specific drug or some trials on specific type of subjects or patients, and analyze their data and perform some simulations, and I would say whether what is the influence of that drug and how effectively it is going to impact someone's lifestyle and quality of life, which is actually the revelation factor in the concept of drug discovery. And as we can see, due to our intrinsic biological structure and the DNA sequence, obviously it is very difficult to see the consequence, or you can see the impact of a specific drug or the side effects of so and so for a long lasting period, and that to be identified. Some specific drugs have yeah, very very long lasting impacts, and which need to be analyzed and over a shorter congested interval to identify. It's not so easy. So AI technology is making, now when we talk about regression and prediction model, can we use a specific type of drug and analyze its complication or predict its complication, which can be foreseen by a specific statistical or a machine learning model to understand its various concepts, and eventually make a mathematical modeling to say that consumption of this type of drug will lead to certain type of complication, and so on so type of drug has no side effects, no complication. So in the process of drug discovery, all these specific challenges are also involved, where we need to look into the side effects, complications, and also validations and data collection, pre-processing, and plenty of other classification, optimization. Everywhere we require all of them. Actually, wherever we have data, now someone say why AI in pharma, why AI is in drug discovery, why AI is in some healthcare medicine. What is the reason? First of all, why AI is here? What is the reason? Somebody tell me. The reason is very simple. Wherever we have data, there we have such a technology inevitably intervening. Now, how do we identify effectively a specific drug discovery by a suitable machine learning model? And do we need to really develop a new machine learning or artificial intelligence model? Any doubt? Please mute yourself unless you have any doubts to speak. So when we talk about such a predictive, or you can say kind of technology to model and then identify the effectiveness of a drug, and then lock it and go for production. Eventually, a lot of every phase, almost every phase, we have data, starting from the subject collection. I mean, it was a data collection from a specific subjects who consume the drug on the trial stage, right? How many of you know the something called placebo trials? Any of you know placebo experiments, placebo trials? Any of you know? Am I audible? Please confirm.
Yes, sir. Yes, sir.
Yes.
Participants,
I'm
please
asking a
respond.
question. Any of you know something called placebo trials on a specific type of drug or a
Thought box
vaccine
also,
type
you
of
can
thing?
give your answers.
So how a placebo trials can happen on specific group of age group of subjects, and if and its data can be analyzed by a statistical or a machine learning model to see how effectively a drug is being functioned. So, on the placebo trials, what exactly, kind of these type of vaccine experiments, or it's a vaccine trials, assume that COVID-19, we have got a new vaccine. Now, when we refer vaccine and a drug, now broad, in a broader sense we speak, most of the time, I would refer the same. So when we refer the placebo trials in the vaccine war, what we have experienced long back, placebo trials refer to whenever a new vaccine is invented. Now people try to perform the trials on a specific age group of people and some other age group of people, etc., like diverse age group of people, to see the effectiveness and then applicability of such a vaccine, or uh, its effect of such a vaccine on multiple people, age group people, different diversity, different geographical location, etc. So what they do, they used to call a group of people, about 100 people, assume that 40 people they try to give a normal vaccine. I mean, some other, I mean, something that is not, that's a common one, that is not the actual vaccine that is being injected to them. Maybe some 60% they take the actual vaccine, but nobody knows exactly except the person who is monitoring. Nobody knows exactly who is the person that is, I mean, consuming the actual one, that is the actual vaccine, and the remaining people who are those who are acting as a placebo trials. So now at the end, combinedly they are evaluated out of these 100 people, 60 people who are actually taken that vaccine and 40 people who did not take that vaccine and they taken some other vaccine. But to outside it appears like a vaccine trial to 100 people. That's called placebo experiment, placebo trials. When you make such a placebo trials, then we'll be able to now coming to data. The moment somebody is consuming, then we see like some sample, biological sample will take, some test we perform, some diagnostic test we perform, and we see how the vaccine is acting upon a specific biological field, and we understand what is the functioning of this. And obviously, as compared to these trials, I mean, those impact on those 60 people who actually taken the vaccine and the remaining 40 people who did not, and we try to make a fair comparison. Eventually, first of all, it's like the effect should be simple, most impact on the other people who consume, and no much significance on the people who did not consume it, something like that, right? So there are certain biological procedures to follow, ethical procedures to follow, some standard formats. So something like that. When we do such a performance, obviously we are in need of machine learning model and artificial intelligence techniques to segregate and make, whether it is a binary classification problem where you use some support vector machines or any other type of thing, accordingly you have to use. So it's very, very important. How do we specifically use such a data and follow up and optimize and maybe first pre-process, classify, optimize all those things to perform for an effective drug discovery process. Okay, because as I mentioned, drug development process is very lengthy, very stringent, very time consuming, and very it has to be very accurate same time. Now, so we talk about detail this time, just basic. What is a drug discovery process? As I mentioned, it's a complex journey where first thing is the target identification. That is, how do we identify specific targets where we are using this? I mean, used by the drug, and then we try to see the impact on that. Then hit discovery, and then we see how exactly it is going to influence a certain type of, diseases, certain type of subjects, certain type of targets. Then we talk about the optimization and how do we lead the optimization of its performance and validation, etc., etc. The drug discovery process mainly involves, like, when we talk about the data sets, how do we take from different subjects who consumed the trials, I mean, who participated in the trial, and then subject wise we take the data, segregate it, and then analyze it and get an accuracy whether we have product successfully done or any complications seen any other same time. So obviously developing such a vast data sets to see and identify the possible compounds and then redesigning the drug. It's not only validating and seeing the performance of the drug, same time when we talk about some prediction mechanisms and some other complicated process, we may also suggest which specific type of composition or compound can have a better implication, or you can say impact on the uh, I mean, medicinally or biologically, how it is going to impact more. All those analysis should be done. Therefore, in drug discovery process, when you talk about in the trials, data collection, data pre-processing, analysis, and regression models, some forecasting, all these things can be understood easily and then analyzed. Now, as I mentioned, a simple, normal, conventional time span for a drug discovery process lasting from, I mean, some 5 to 10 years, 20 years, sometimes 15 years, 10 to 15 years typically on an average. And costing very high, about 2.6 billion on an average per drug, subject to what type of specific drug we are investing. Very, very expensive. And what percentage of success when we refer to drug discovery, which eventually in need of artificial intelligence to optimize that. People say that less than 10% success from clinical trials, what and all experiment we are carrying out to develop an effective and efficient drug. So this less than 10% success. Sometimes it may be like some companies may vary also. Some specific companies they may have less than 5% success, less than 2% as depending on the concept of, or you can see the percentage rate of success. It refers to what standard protocols are and procedures we follow in the process of developing the drug, and accordingly the success rate would be plus or minus, but typically it's less than 10%. And when it comes to introducing some artificial intelligence technology for drug discovery, this will accelerate this process of developing. What do you mean by accelerate? Which process we can possibly optimize? I'm using some AI technology. See, clinical trials I cannot compromise. I have to perform as per the ethical standards and standard procedures laid down by the governments and policymakers. Obviously. Then what else left? Anybody? How do you feel actually this is going to be influencing? Any of you? In what sense you expect like AI technology is going to optimize certain so on so phases of drug discovery? Anyone? Any thoughts? Because I'm saying I'm using AI technology does not mean that a drug, I mean the drug whatever I develop at this stage it has to be trialed on so and so number of patients for so and so months. That we cannot change. The human trials or any other trials on animals or whatsoever, all those things has to be, they have to be same maybe most of the time. Then where do you think that AI technology is going to assist us in the process of drug discovery and etc. development? Either development or discovery. In either case, but how do you expect it will accelerate? The trials we are performing same, number of subjects are same, data will be same. Then where else, where do we really require the concept of artificial intelligence models here? It's saying it will accelerate discovery process. It also reduces the cost size and also increases precision. All those things. But how? Any guess? Anybody? Any guess? Just guess. No guess? See, first of all, when you talk about an effective use of an AI technology, maybe for optimization, what do you mean by optimization? Sometimes with an effective AI technology, I would guess or predict what is the exact number of subjects required or trials needed to validate a specific type of. I can optimize. At the same time, if not human, I mean manpower that is required, if not manpower, maybe I can also see using effective technology. I would see that what exactly the time span of those trials, and also once the trials are done, I can perform the optimization, and I can also make a proper classification of those data, such that I mean, when we can segregate analysis can happen at a faster speed, and eventually the discovery process can be expedited. We can expedite that, right? And similarly many other applications of this kind. And now why, as I mentioned, like now when we talk about the why AI is inductive, faster say the continuation of say faster identification, it rapidly identifies the drug candidates, viable drug candidates. That's one such example. What are the suitable drug candidates that are needed? Now, see, drug composition don't simply say that when it comes to trial or experiment, that is the almost in the front end one. Once the almost the prototype as a drug is ready, just to fine tune maybe the purpose. When it comes to identify or to have a specific drug composition, which specific candidates are most suitable or viable. Such a drug candidates can be identified or optimized or analyzed using the AI-based technology such that we can effectively identify them and use them. Then we have cost reduction. And how do we reduce cost using AI in drug discovery? We can automate process every time we need not to take, and we can have some wearable technology, wearable devices on the humans who are undergoing for some trials of these new drugs developed with all the followed ethical considerable protocols. Then eventually when we have such a data is collected and analyzed in real time using some body area network type or whatever it is, and then the data is captured and analyzed in real time, and accordingly some decision can be taken, like I'm taking some data, collecting manually and sending to lab and etc. etc. If you have an assistive technology, an automated process, it does a lot of time to save. Obviously, when you have such a sophisticated technology, we can minimize the cost on R&D in the process of developing a new drug. That also makes. Next, we have improved accuracy, and obviously accuracy and the possible human errors we can minimize, and also conventional deterministic techniques when we use to validate a drug. When used with AI technology at a faster rate we can do, and also with a lot of accuracy. And the same thing can also be used when we have some extensive training data sets. So it reduces some kind of false leads and also minimizes the human errors.
I got
That
one
is
doubt.
There's another such example. And similarly, we have to develop this personalized medicine. How do we uh, analyze those complications, and then uh, develops a set specific drugs for these type of personalized medicine or healthcare applications?
Yeah, yeah. Sir, I have one doubt, sir.
Yes, yes, please.
Sir, really, it is a small doubt, but okay, I just want to ask that, sir.
Yes, yes, please,
If
please.
this AI plays a vital role in drug discovery,
Mm.
maybe physicians and doctors, their requirement may be somewhat less. Like that, it can impact the physicians and the career of physicians or something. Requirement of physicians, doctors, like that. Anything happens.
No, over the time now, as I mentioned, that's another problem. For example, if you see during pandemic time, we have got shortage of a lot of medical practitioners, and it was very difficult to get an appointment of the doctor. There were a lot of, lack of facilities from the, these medical facilities, availability of the doctors. Now, assume that we are going to have a kind of a recommendation system, or you can say some kind of human computer dialogue type system where we can train a computer, highly sophisticated and accurate computer system that is capable of interacting with the patients over a, online mode or Bluetooth or Wi-Fi, etc., etc. Then
Okay.
it can hear to the patient. Just to understand, it can hear to the patient and ask like, what is your age, height, weight, and what is your problem. If you say stomach ache, headache, okay, it is noted. Then since how many days, it is noted. Then what is your age, height, weight, and what did you eat last 4 5 days, and how long this is there. Considering all of them, it is like a trained data set. A deep learning model can conveniently see what could be the most probable disease or the problem that is faced by. So if you observe this such a technology, if develop, obviously humans can never be replaced by computer or a robot. That is because we are all going to develop them. Certainly, what happens, but when it comes to such a
Yes,
level,
sir.
such a technology
For
will.
general problems, we can use this AI technology.
No, it's the same problem I'm talking here. So now, when we talk about such a technology, where when it
Yes,
comes like online teacher, it can teach, a computer
yes,
can teach 100 students parallelly. Same time we
yes,
have
sir.
like online doctor.
Yes, sir.
A high-end computer can diagnose, may not probably teach. Maybe for diagnosis process, it can take the help of a computer. Then same time here also,
Okay.
but what I'm talking is not a recommendation system. Like now, if you are not feeling well, you open your
Yes, sir.
computer and there is an application where it tend to ask your age. May name doesn't matter. By name, it cannot say anything. By age, height, weight,
Yes,
and any other hereditary issues. You have diabetes. You have any other problem. Finally, what is your current problem? Based on all the previous and how many times you have taken antibiotic in the last 1 year, which antibiotic, all the details it asks. Then currently, what is the symptom? No, it say finally you have possibly this disease or that disease, and you may need to
mm,
consult. If it is 100% sure, let's say. So that's the kind of recommendation system for diagnosis purposes. Now, when it comes to drug discovery, I'm talking about mostly the corporate side, or you can say pharma side, where it will help the people, because the drug discovery is very, 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 expensive and time-consuming process. If you use AI technology and minimize, like normally there is a saying, to develop a one specific vaccine, it takes minimum 10 years time, around 10 years
okay.
minimum, to have an effective vaccine. But obviously,
Okay,
when
sir.
we are in desperate need of this pandemic situation, we could manage to
Mm.
develop in 6 months time, or maximum one
Yes.
year time. In 6 months
Mm.
time, clinical trial started, and one the 6 months time, they developed a vaccine.
Yes, sir. Yes, sir.
But the problem is, do you think that now after 4 years we are talking about some XYZ vaccine has some side effects, some so and so, some people consumed some specific medicine, then they had faces some side effects. All those things. I don't want to name any vaccine or medicine, but same
Mm.
time, after 4 5 years, we're talking about we have done in hurry and it should have some complications. Yes, that means why? Because drug
Mm.
discovery process is very 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 lengthy. But
Yes, sir. Yes, sir.
obviously, when we do it in one year, 1 year time, it takes some complication. To avoid or to deal with those things, if you use AI technology, like simple logic, if I consume certain type of a vaccine for so and so day, 6 months, if these are the complications or symptoms, what will happen if I consume for 5 years? What could it is as good as a machine learning problem prediction. 6 months if you use, this is the data. What happens if I use 5 years? Then what happens? That's a machine learning problem. You have some supervised data. 6 months I have used, a patient has taken drug. Then what happens
Yes,
for
sir.
5 years? Do you have any complication? That's a machine learning problem.
Yes,
That's why
sir.
it automates the process,
Yes, sir. Yes, sir. Yes, sir.
right? And also it
Oh,
reduces false leads. You just see that is very important. It will improve
yes,
the
sir.
accuracy. So all those things. But like you're asking, that is also possible when we talk about a recommendation system for
Yes, sir.
diagnosis of a disease. So
Yes, sir.
consultation can be automated. Diagnosis can be automated. Maybe sometimes treatment also maybe.
Yes, sir. Yes, sir.
So
Okay.
that's all. With the evolve now, whenever I refer AI does not refer to only software I'm talking about. When I refer some AI assistive technology for drug discovery, it may not be just a software modeling I'm talking about. It may be a AI enabled body area networks that will monitor the influence of the drug 24 by 7 of a particular person who had undergone for the trials. Right? So eventually what happens? Such a technology also would be that's obviously AI technology that's integrated with some front end IoT or an embedded system or whatever it is. Right? So obviously, when I take such a AI technology in conjunction with hardware and only software, whatever it is going to help for all these analysis, complications, predictions, everything like that. Okay.
Good afternoon, sir. Good,
Yes, yes,
good
please.
Sir, one small doubt. Sir,
Please.
drug detection, is it possible to do, sir? Like for particular patient,
Ah,
among the we have a number of drugs these days, sir, for one
yes,
disease,
yes,
one particular disease.
yes.
So, which set of drugs is more suitable for particular patient? Can we design that kind of
Yes,
smart
yes.
drug
If you
detection, sir?
observe, what you are asking is a supervisor problem, simply to say. Now I have supervisor data. You see,
Hmm.
my age is something, my height is something, my weight is something, my sugar levels are something, my BP is something, etc. Then I've trained it. Then I would say how much amount of diabetic or some what you can say
Hmm.
azithromycin I have to take. How much amount of for this problem. Obviously, what happens? It has supervised data, but
Hmm.
actually it cannot be unsupervised. But now it should have taken a lot of training on some what you can say 1,000 patents. Somebody consumes so and so drug for so and so complication for
Hmm.
so and so, but I mean problem for so and so time duration. Then he faced this is a complication. So obviously we can have a recommendation system. But the problem here is that is the difference between a robot and a human. Now,
Yes.
obviously, when a robot gives multiple, now see, if you go to a doctor,
Hmm.
sometimes a doctor suggests for he will examine you. He would
Hmm.
suggest you your symptoms like this. You go for some paracetamol, dolo.
Hmm.
Then if you go again him, he will change the medicine.
Yes, sir.
Why does the doctor changes? It's not his mistake. At that
Hmm.
time, based on the symptom, he might be thinking diabetic, maybe antibiotic not required. Only with
Yes, sir.
dolo or paracetamol, some simple it can go. Is it is continuing means what? It may be some other severe fever or something. Then you'll go for
Yes.
some antibiotic. If it's azithromycin or what you can say, whatever it is. If not something, then again he will check maybe for blood test or any other value. Then he will say it looks like typhoid or malaria. Then some other.
Hmm.
So this type of swapping happen in the human intervention also, human consult. If you go to a doctor also, he has the same problem. But
Yes,
same
sir.
time, I don't want to make it controversial, but same time, if I go with the computer also, but computer can say these things in on same day. Possibly you can have malaria or typhoid or this one, but currently it appears
Hmm.
more probability that you have a normal viral fever. You take this drug.
But
And
yes, yes. But in case of
yes,
like diabetes, which is a continuous long life disease,
yes,
in these cases, we know that these are the particular medicines for diabetes. But
yes, yes,
uh, few medicines have side effects also, no, sir.
yes,
That is causing more harm to the body in trial cases, like
yes, yes, yes,
giving one medicine and for 1 month trialing it and again trialing it,
yes,
causing more harm than the benefit.
yes, yes.
So how to proceed with this kind of thing when we know, okay, the disease is diabetes and it's a lifelong disease. Now, which particular medicine is suited for the patient, this patient? Can
Yes,
we
ma'am.
design
Now,
the structure?
obviously, you can design, but if you observe to design that also, first you should have this is as good as a trial and error. Now, if you see, initially we experiment on some rats or something,
Hmm.
then we make it like now the human trials are permitted because it is successful on rats. Does it
Yes.
really mean that it will have no harm to humans?
Mhm. It will harm. It will harm.
No, definitely it will harm or it may harm. The
Yes.
reason is
Yes.
it was successful on non-humans. Now the question is we are doing on humans, but we expect directly we do on the entire population of the humans? No.
No.
Then we do what? On some specific age group of people and some 20 to 30 age group, some 100 people or 1,000 people they do. And of different geographical locations, something like that. Or maybe some
Yes.
other condition. then some elder people, then some kids, like that, different tile subject to what. Then
Group
finally
of
what happens? Then they may see some complication again all of a sudden. Then again they have to go back and fix it. Then again on the rats or again whatever the non-humans they experiment. Again they come to humans. So, but like you said, this problem is there until we come to such a state of evolvement of the drug such that it has no much major complication. Only then they will give that so-called what you call that permission to release in the market. There is a name, technical name for that, the clearance.
So,
Until then, now we have to monitor with following all the ethical procedure. Like you said, now this type of complication we can minimize that. Like you said, we can minimize, but we can get it to zero. Obviously, some trial and error is required. Now, if you observe, any such unsupervised learning algorithm should be supported by supervised data. Unless we train a model, I cannot make any learning, right? Like if you just take a deep learning or a neural network, you have some training data. Like you
yes,
see,
sir.
I'm going to detect based on some complication the person is diabetic. How we detected? Previously, some person was already diagnosed as diabetic, having similar features or symptoms. So somebody was already had that complication. We trained our computer a model, something like that. But like you
Yes.
said, that's really a good question. But to minimize that, we are using AI technology, like with some effective supervised training model. We are going to have an effective like deep learning architecture where we have handful amount of supervised data and large amount of unsupervised data. Here the benefit is the large amount of unsupervised data based on small group of testing that happens, whether it is human trials or etc. etc. Something like that.
Thank you. Thank you.
But that's a good question. Only thing is here we use that such a ML technique, AI techniques to minimize that thing and expedites the drug discovery process, etc. Something like that. Now, because I think some of you are asked a similar question. Now, using AI, we can also have a recommendation system that doctors, we can play a role of doctors. We, in the sense, the computer can ask question. Now, computer can play the role of doctor.
No, he
Yes.
can just
Yes,
advise.
it can play. But the problem is what? Problem is again the same process. Now, doctors also sometimes when they're treating, there will be some complications and other things will be seen. Sometimes they change the medicine subject to symptoms. But the problem is we should require a highly sophisticated, validated computer system that does that attend these type of problems like. But in my opinion, such a facility should be limited to only the basic problems like maybe I have a now see a computer cannot perform some diagnostic test. It can only recommend your symptoms seems that you may have maybe you may have to go for a like typhoid test or malaria test. Then you have to go to lab again, then do the test, then come back and say I'm positive malaria. Then it may suggest you have to use these type of medicine. So such an automated system can be developed, but for now we are not up to that level of depending on such a hardware and software technology to
मामा मेरे को
replace the
वहां जाना है
doctor
टेलर
as
के
of now.
पास
But when it comes to surgeries and obviously all those things, now we are talking about a
सुने
robot is performing a surgery. Even that also we are replacing with machines over the time. But having said all of this, we are never going to replace the human doctors by a computer, a supercomputer, or a workstation because obviously human brain is the most powerful biological thing that is powerful than any machine or something in the world.
Yes, sir.
I think that's
Thank,
but
thank
people
you,
can
sir.
focus on such a recommendation system for a drug or you can say medicine type of thing. That is one such application where people can focus on for a specific thing. That can be a pioneer research what we are starting. Over time it will be applicable to the people, but not now.
Okay, sir. Thank you,
Right.
sir.
Yes, yes. So similarly, AI application in drug development, as I mentioned. Now application, how do we like the same? What do you have? I think some of your questions, how do you ask? But I'm talking about in the drug development part. Now, target identification, that's very, very important. How do we use some specific AI technology and analyze certain like these biological data, genome data, and find some specific disease associated targets. So that what happens with those targets, we can have some specific composition which can target on that and then possibly cure. Because the target identification is very important. Otherwise, if you go for a general one, sometimes a specific compound or composition when you use, it will also affect the other part of the body. So how do we identify the targets of so and so using the so and so structure of the biological patterns of the human body? So the disease associated targets is very, very important. This will optimize the what you can say complication, minimize the complications from the drug. Next is drug screening. Uh, how do we predict the drug efficacy and side effects? That's very important. Now tell me, how do we perform this using AI techniques? Now we see so and so different composition we take, and we see using a machine learning technique. This type of all possible composition I take, and based on the other realistic conditions, we try to predict. It is as good as something like an association rule which we see in your data mining. If this drug and this composition and this group of people and for this problem, finally what is accuracy, what happens, some specific class, something like that. An association rules or some deep learning based architectures or some widespread optimization algorithm, some genetic algorithm operation, like even you can conveniently use here genetic algorithms and others and other similar applications here. Okay. Now, next thing we have like clinical trials optimization. Like this is when enhances like when we talk about these, how do we recruit the patients and trials and perform trials and then design the trials and then optimize the outcome of these for a better understanding over the impact or performance of the drug, performance in the sense its effectiveness over a specific group of people which are undergone for the testing purpose or the trials. Okay. So this is very, the third one is very, very important. Even like a lot of scope is there using machine learning and AI technology, like some AI assisted model for a clinical trial optimization. That's one of the wonderful applications of AI towards drug discovery. And similarly, the last one is post market surveillance. What is this? No, see, we have once the the real-time data is considered, how the drug is going to be safe, and then how it is impacting, how does it impact, and then what is the possible complications, and say, I mean, these side effects can be seen. So, post-market surveillance using it is as good as a prediction mechanism, something we can have if I develop this drug with this trial thing. But this is depending on a previous, like how I make the all these optimization everywhere, and finally, if I release the drug, and finally how it reaches the people, and how the market will be, and how the uh, drug tissues are going to be monitored. All those things can be taken care in this post-market surveillance phase. Any doubts so far?
No, sir, no doubts.
Yes. So now, what are the major technologies where we try to evolve using artificial intelligence in the application of drug discovery? Mostly, as we can see, obviously by name we can say every people say deep learning is most suitable. Yes, obviously, deep learning is one of the why, because the moment I have little bit of training, where do I get the training? We perform a lot of experiments, a lot of other things. Obviously, I get a lot of training here, and a lot of supervised data sets can be created. So deep learning is one such most suitable tool towards effective drug discovery process monitoring. And other machine learning models, where do we use them, like regression and other all these other data mining tools, where we predict the molecular activity and also how the drug interaction take place once the usage levels into the picture. And similarly, natural language NLP applications. Can somebody guess why do we use this NLP here? See, some scholarly literature I will take and then look into that using the natural language. We try to extract some understanding of the drug discovery process and also see the complications and foresee this one. So, in the process of drug discovery, when we talk about this NLP, and if you can have NLP engine that takes as an input some about 1,000 or 10,000 scientific literature articles, and give us a suggestion like this type of experiment you perform, this type of placebo trials you perform, this type of correlation or compound correlation you make, and etc. etc. And it can also suggest the possible mixture of are the formula for the drug also which can optimize. But of course, when it comes to that, that involves a lot of chemical, composition training is required. Accordingly, we have to make such a. So NLP is also playing a lot of role where we analyze certain scientific related documents and understand a bit more about the better discovery or development of the drug that we intend to develop for a specific disease or a specific age group or a specific type of persons with some disabilities or etc. etc. Okay, and similarly we have ChatGPT type or other generative AI models where this is one of the very very important. But when it comes to using generative AI, how it was trained on various existing drugs which are developed or discovered already for the similar type of problems, and then based on them, possibly it can find a different permutation or a combination of drug molecules such that drug molecules and chemical compounds such that which can lead to a better composition that will give a even effective even more effective drug. That is one such application to be identified. Anybody wants to add anything here, like any other now, which one you feel more scope possibly in this four, if you want to do some specific application for drug discovery using AI ML technique, which technology you want to, like which AI technology? Any guess? Any guess? No? Like I want to work for some AI model, AI based technology for drug discovery. Whether I should go with just the first one, second one, third one, fourth one. Where do you think a lot of scope is there? Obviously, first is obviously it's a deep learning based models because plenty of training is required to understand. That is one such. Anything else? Anything else? So, see, obviously, like I said, NLP, generative AI also we can identify, and most of the others are fine. When it comes to using NLP also we can have a lot of possible research scope based on existing some text documents and other things can be identified. So everywhere there is a scope, but when it comes to deep learning based approaches, there is a lot of possible scope towards this problem. Now, various benefits of AI in drug discovery. Now, how the technology, different technology, what type of technologies of AI we use. Now, what are those benefits of AI in drug discovery? Now, the application, like when it comes, the outcome is like we have a minimum development time from years to months. Planning to come from like a lot of years to months they want to develop. Obviously, when we can perform optimization, a lot of optimization algorithms from machine learning and artificial intelligence, it's quite possible. But let us see from here, that is a target. There's a benefit. A lot of 10 years drug I want to develop in 10 months or something. Because this 10 years is the investment period for the company, right? Whenever the company is, I mean, developing a drug, this 10 years is an investment period. Investing for 10 years and then earning, expecting the profit, that's very challenging, right? And these 10 years on the specific drug, they may not have a single rupee profit. But once the target is successful, they will have a lot of profit whenever it refers to. So obviously that is very, very important to note. And similarly, improved accuracy in target validation. Yes, that is one. Like how do we validate our I mean, this one composition and see how effectively it is working and optimization, everything. So the accuracy is being improved. How do you validate our targets? That is important. So improved accuracy. Then we have obviously less R&D cost. When we are minimizing all of them, the cost we are incurring on cost incurred on R&D is very less as compared to the other conventional research mechanism that we use to validate and introduce to the drug. Right. Next, we have this type of technology which will enable personalized and precision medicine, as we can see. Like the some of the question, the previous question which you are asking, this type of AI technology, it will motivate or encourage for personalized and precision medicine. The same question what you are asking, I think some of you are asking, right? How such a supportive or accurate recommendation type system exists where personalized and same time precision medicine. And what is meant by precision medicine? Somebody guess? Anybody? What's the precision medicine? Anybody guess? Anybody? Anybody? What is precision medicine?
Personalized medicine.
See, when you talk about like a specific drug or a medicine, where we have where that separates people into, like, we have different age group people, different type of people with different. How to have a personalized, I mean, recommendation system towards a specific type of architecture, a specific type of recommendation. That is also quite possible with this type of AI technology for this. Then next we have challenges and ethical considerations. Now we have, so far we are talking about, now what are the challenges here? Because we have got a lot of AI models already available. We need not even look for new models. Plenty of models already. Hardly we may need to improve them a bit. And also we have other high-end computing with the development of big data analytics. We have petabytes and hexabytes of data also easily handle, and we have no memory issues with the development of cloud computing. Then where are the challenges and a lot of other considerations when we refer to in this domain of AI assisted drug discovery? Tell me other challenges. The main problem is with this availability of the data, because most of the experiments are something that are with reference to this type of compound, a chemical compound or molecular compound that they have used for drug discovery. It's mostly confidential and very limited access will be there to data set. Obviously, that is a data availability is a major challenge, and there is a lot of privacy issues are there, and you can't get the data easily unless you have signed an NDA, non-disclosure agreement. Non-disclosure agreement. That is one such problem. And similarly other AI model limitations, and the existing AI techniques have certain challenges and interpretability, limited interpretability. How do we effectively, I mean, develop next level models to have such a similar level of understanding? Next, we have regulatory issues. When we talk about, I developed a deep learning based model for so and so type of drug validation, etc. What is the validation? How do you, some people say that okay, this is good or bad. So the validation and approval of that particular AI driven architectures that you have developed for drug discovery, that is because you have done a smart work using some AI technology in developing such a such a, I mean, effective drug. But how people validate using your technology? Some trials have been done for 6 months, you have completed in 2 months, assume that. How it is possible? The validation and approval, that is very challenge, very hard. Then finally, ethical issues, and the challenges some of the companies may tamper the data sets or may produce inconsistent or biased data sets, and how the to promote the drug if some effective uh, drug discovery process compromised potentially, and then the decision making process is not at par with the standards of the policy decisions, then how do we effectively understand them and then identify these type of ethical issues will be very very challenging, and this is very very important in this type of work. That's truly very challenging here. And then we have these among all this, when we refer the first and second one is look appear to be more challenging. The rest of the things are like they are different purpose. I mean, they are in a different dimension. But the first one is the availability of the data, limited data challenges, and then limited data access or availability, and then we have that problem with the existing AI model, which have to be fine tuned and remodeled or improved or developed to have a better understanding and to have a better performance. Because the available part of something is different here. Next, we have AI algorithms in drug discovery. As I mentioned, like same thing, whatever we have highlighted, some of them. Machine learning, deep learning, and the prediction models for the molecular behavior, and other forecasting or prediction method, all those things. And some other data mining analysis models. Now, when it comes to the conventional knowledge discovery process, where the data to information to knowledge to wisdom, you see, it is very important uh, to perform the data mining process in all such molecules uh, analysis and extract the valuable information from those biological features or patterns. That is very challenging. Now, obviously, see, like most of the time, to understand the functioning or impact of the drug, we need to highlight or unpack the lot of undermining uh, patterns, which will help us to have a better idea about the drug that is being developed. So, to have such a thing, lot of sometimes privacy preserve mining technology we may have to be required. Privacy preserve mining, and sometimes other security issues, and all those things are very very important. So data mining is one of the major challenges in this type of applications, keeping the security issues aside, and also and how a new drug development strategy can be identified using the data mining. What is the specific tool for that? Everything has to be seen. And in clinical trials, as I mentioned, all those things whenever we are seeing the clinical trials also. What is the kind of AI technology when we refer? And how do we identify suitable patients and the populations? And also just seeing foreseeing some specific type of things using them, and how more efficient trials are being performed, and then important decisions can be made towards the drug and its performance. And next we have challenges in AI integration. Like I said, now we have talked about everything, but how do we integrate that a specific AI technology for the sensitive data that we are being collected, right? That is very, because integrating AI into drug discovery process is very very challenging. We need to follow data quality, these regulatory issues, and then maintaining the skilled people. That is another challenge. Somebody with all this background of drug discovery, this molecular analysis, and also machine learning and AI. That's one. And what happens in the future? What do you guess? What will happen in the future for this type of application? happens in the future. So when it comes to future level, obviously it may be expedite the strengthen the development process of a drug, and we try to have conclusions at the earliest, and we try to have more effective vaccines and drugs, etc. And then analyze them, and also more accurate and, like I said, customized, personalized medication system or drug detection models can be developed here. And also, uh, whenever we are going to have such a competitive AI technology for drug discovery, because the investment is going to be less, obviously over the time the cost of the items or the medicines is also going to come down when it comes to. So with the highly evolvement of high evolvement of artificial intelligence in drug discovery process, over the time it becomes the rates of the medicine will be at reasonable price. Same time, the accuracy or the performance or impact of this would be high, and many other challenges. Something like that.
అవును మళ్ళీ అది ఎక్కువ రోజులు రాకపోతే వేస్ట్ అవుతుంది.
So this is very very important phenomenon when we
అయితే
are
మంచిది చూడడానికి మంచిది.
other future directions, and we have when we integrate with other fancy needs like quantum computing and even digital twin and ecosystems, when you develop or collaborate with and autonomous drug discovery thing, a lot of scope possibility to do the research, right? For faster molecular simulation, like obviously quantum computing, when we refer, when we get faster computing capability and we try to analyze the molecular these compositions and the simulations at a faster speed, eventually the development process would be fast. And similarly, expansion of digital twin, how digital twins are very very crucial, particularly in this drug design process. If you have a digital twin like structure and then make all that possible testing on the prototype and see how effectively and efficiently it is, and then develop the actual one, that is one such thing that is very very useful. And next we have collaborative systems where all those industry and academia can be combined, and then the technology people can be used to have a more sophisticated drug discovery process. Next is autonomous drug discovery. The fully automated AI powered R&D systems can be developed, but anyhow, that's part of all what we talked about. It takes time. I think I'm starting here. Let me know if you have any doubts, because almost we are done. We have another 3 minutes left. So we start early. I have some other meeting. I'll just leave quickly. If you have any doubts, you let me know, please. Am I audible? Can you hear me?
Sir,
Any doubts? Anybody?
yes, sir. It is audible, sir.
I'm done now. Almost I've concluded. Any doubts? Anybody? We have another 3-4 minutes time. Please, I'll clarify.
Yes, participants. Sir, there is a one question through chat. Integrating AI into drug discovery presents present challenges, including data quality. Apart from here, there are any challenges? There are any challenges?
Okay, let me see that question once. The chart was integrating AI into drug discovery presents challenges, including data quality. Apart from the any challenges, as I mentioned, other than the current challenges we have, like I mentioned, the more important challenge is validating. Like I'm developing a AI-driven model for drug discovery. Who will accept that model? As per the standard procedure, I'll say 10-15 years it require on average. Somebody say more than that. Then how do you guarantee that I have used a specific technology I've done in 2 years? Validating or making the trust out, that is very challenging. And similarly, other challenging is you have a specific AI model for a specific type of drug. Thus, can you generalize it for any other drug disease? Because thousands of variety of drugs are being, the lakhs of different type of drugs are being evolved. So how do you guarantee a specific for every time for every drug you're going to have different deep learning paradigms? Very difficult. So scalability and generalizability. Those are the other challenges, like that, something like that. Many other challenges. Any other doubts? I think somebody asked me for slides. I'll share the slides with the organizers. They will pass on to you. I'll be sharing the slides. If some of you are not seen the slides, I don't know what is the reason. I'll be sharing the slides with you. Please go through that.
Okay, thank
I'll be
you.
sharing with the organizer. They will inform. I'm also posting my email ID and phone number. If you need any help, please feel free to contact. I'll be happy to help you. I posted my email ID and phone number. Please feel free to be in touch if I can. We have some help. I'll be happy to extend. Any doubts? That's all right. If not, then we can conclude. Thank you very much.
Participants, any doubts? Okay. Any doubts? Once again, thanks to Professor Damodar Reddy garu for giving wonderful session. Really, it is a challenging task as a computer scientist, giving a session on drug discovery as well as regard which is related to pharma industry. So very even sir has given a very good knowledge about drug discovery management. Thank you very much, sir.
Yes, sir. Thank you, sir. Thank you. Thank you. I'm happy to be part of this event. And any other doubts, please feel free to contact. I'll be sharing the slides with you and let me know if you need any further from my side. Okay? Yes.
Okay.
Yes. And so I'm signing off. Anything else, please let me know. Right.
Participants, next session will be on natural language processing and brain computer interfacing by Dr. Ravichandra, that is myself. Please be online. Niharika is there?
Yes, sir, I'm here, sir.
Hmm.
So here is a brief description about our speaker, Dr. Ravichandra. Sir has been an professor at SR University, Warangal, Department of ECE since 2007. He is an senior member of IEEE. He received his PhD in the ad hoc wireless sensor networks field from the JNTU Anantapur in 2017. His research interests are brain-computer interface, AI and ML. His research papers are published in reputed international journals and international conferences. He had successfully completed three sponsored projects funded by the DST, SERB, UGC, and MHRD, designing novel hybrid EEG BCI based interfaces navigation system for the severely disabled persons sponsored project cost 31.18 lakhs granted by the DST SERB distributed location for wireless sensor networks using particle swarm optimization project cost 4.4 lakhs granted by the UGC under minor research project scheme, and the third project perennial fund of 1.75 lakhs Unnat Bharat Abhiyan for implementing UBA activities in adopted villages. He had 12 patents. He is a editor of book Human Machine Interfaces Technology advancements and applications. He had written 3 books on teaching, learning, pedagogy. He is currently focusing on research on brain-computer interfaces. Thank you, sir. We are welcoming you for this session.
Thank you, Niharika, for giving a brief introduction about me. Thank you very much. Today, I want to share few research advances in brain-computer interface, and one of the application of it is natural language processing. So, I'll make it as a interactive session. It's not like one-way session. Please, if you feel free to ask any question at any time, I will share my research perspectives and regarding this brain-computer interface as well. So, first of all, I will share my screen. Are you able to see my screen? Are you able to see my screen? Niharika. Hello? Are you able to see my screen? Participants.
Yes, sir, we are able to see, sir. You can.
Is it changing? My slides are changing. So now, yes. Hello?
పొద్దునకంత వాసు ఉంటుంది మీరు పేపర్ స్టేట్మెంట్ ఇచ్చి వాసు పరీక్షని ఈ జూత గురించి చెప్పండి
Yes. Okay. Okay, now I will. One minute, just I will participants. Okay. Here in today's session, I am going to discuss about brain-computer interface and its medical applications in natural language processing and healthcare. So first of all, what do you mean by brain-computer interface? Anybody? Niharika is there? Niharika, Monica, or scholars are there? What is brain-computer interface? Let us make it as a interactive session. Dear participants, what is brain-computer interface? Tell me, anybody? What do you mean by brain-computer interface?
Sir, Malati, sir.
Yes, Malati madam, tell me madam. What do you mean by brain-computer interface?
Communication between our brain and system.
Yes, excellent madam. So I would like to add one more point. Communication between brain and system, that is fine, but without intervention of physical connection, without any physical connection, we are able to control any communication device or any physical device that is called as a brain-computer interface. So, which is the fast-growing emerging technology nowadays. We already know that one person, Elon Musk, so he has started one company that is Neurosky. So here in that is developing so many brain-computer interface products. So it is a fast-growing research area nowadays. Brain-computer interface means without any physical intervention, the brain signals that can be translated into commands. That is called as a brain-computer interface. Thank you, madam. Now, if you look into the brain-computer interface model, for example, let us take this is one person. Here is sitting here. Now, we will take the data. We have to perform some operations like pre-processing, feature extraction. We use some algorithms. Then finally, that will be translated into commands like here. Then again, the commands that will be given to this particular person as a feedback mechanism. These are the basic components. What are the basic components? One is data acquisition system, processing, feature extraction, using of innovative algorithms. Then that will be translated into the commands. These are the basic components in the brain-computer interface system. Now, once again, I will come back to starting point. Here we have a brain. Now we are taking the data. As we mentioned earlier, we are taking the data here. How we are going to take the data? Data acquisition system means how we are going to take the data? Means we are going to take the data by using one particular device. The device is called as EEG, electroencephalography. We can use some other device also, but here in our topic, we are using EEG device. EEG stands for electroencephalography. Now, whatever the signals that are taking from brain, it is we cannot directly give it to the computer and give translate in the commands. It is not like that. Why? Because brain is a complex machine in the world. Most complex machine in the world is brain. Already we know that. So it has a lot of signals. We cannot identify that signals, which signal belongs to which type of commands, which signal gives So for that, we have to carefully pre-process that signals. We have to carefully pre-process the signals. So how we are going to pre-process the signals? Using some filtering techniques. What are the filtering techniques we are going to use? Here we already know what are the filters. As a electronics engineer or computer engineer, we already know there are some low pass filters, high pass filters, some different innovative algorithms are there, some different Chebyshev filters, some IR filter, FR filters. There are different types of filters are there, but it is not a simple filter we are not going to use. Some innovative filter we have to use. That is the first step, first and foremost thing in after taking the data. After taking the data, first we have to clean the data. That cleaning step is known as pre-processing. That clean step, cleaning of the data, is known as pre-processing. Then after that, we have to extract the signals. We have to extract the features. Features means it is not general features. So this whatever the taking the data that is in the time domain, that whatever the data we have taken that is in the time domain. Now the time domain signals we have to convert into the frequency domain. We already know what type of techniques we can use to convert this time domain signal into frequency domain. We have a lot of techniques: Fourier transform, Fourier series, some different transform, or DFT, FFT. There are different techniques are there to convert time domain into frequency domain. Now, in the frequency domain, what are the features we are going to extract? Like PSD, mean, if it is a time domain, mean. If it is a frequency domain, we have to take power spectral density, autocorrelation function. Like that, we have to take some features from the each after extraction. Then, after taking some features, we have to apply some algorithms. Now, usually, as a brain computer academic scientist, we naturally work in this particular area. What area? This developing some algorithm to classify the signals. That is the one particular area we can work on it. This is the one best part we can utilize for our research. Are you getting my point? Is it clear? Any doubts here? Am I audible? Okay. Yes. Please give your response. Start at least.
Audible, sir.
Okay. Thank you, madam. Now we have to use some algorithms, efficient algorithms, like some machine learning algorithms, artificial intelligence algorithms, some deep learning models we have to use for classification of signals. What signal, what type of signal we have extracted from the brain, like that we have to use. That signals will be translated into the commands like visualization here, sound sonification, artification, haptic and tactile stimulus, olfactory stimulation, like this, which can be used for different applications. These brain signals that can be translated into the commands. In that way, we can use this particular signals. Now, this is regarding the brain-computer interface model. There are different blocks. Here I have explained different blocks. Now, after that, here, these, whatever the signals that will be again given the feedback to the particular person. Why? Because to improve that particular thing. Now, here, how your brain computer interface works. Here, brain computer interface, here it will works for the person. Here, the patient mentally visualize both hands closing. So there are different paradigms are there. How brain-computer interface works means here, there are different paradigms are there that I will explain later. Now, first and foremost is here, I will explain what here brain computer interface. Here, how it works means here, for example, here one particular person sitting in front of the computer who is unable to move his hand or leg, then what he will think that here, okay, I'm moving my leg like this. Here, he is a person, is a one person, is just sitting in front of the computer, and he think that I'm moving my left hand. Is thinking. The patient mentally visualizes both hands are closing like that. Both hands are closing. When he feels both hands are closing, then it generates one particular type of signal. When that particular person, when he releases that, he mentally visualizes, releases that particular hands at that, in that particular point also, here that will be another thing here. It also generates that type of signals like that. Now, what are the brain computer interface approaches? What are the brain computer interface approaches? Here, brain computer interface. What are the brain computer interface approaches? Here, there are different types of brain computer interfaces. Here, one is invasive, semi-invasive, non-invasive. There are three different types of brain computer interface approaches. Invasive means that whatever the person who is undergone that particular brain computer interface experiment, he has to go for neurological surgery. That means some brain, they will generally implant electrodes inside the brain. That is called as a invasive. That means inside there is some, we need to do some surgery, some specific surgery for that person. That is called as a invasive BCI. Next, semi-invasive. Semi-invasive means on the scalp, they implant some electrodes. That is called as a semi-invasive. They will use some, they will just some types of pins they will keep inside your brain, just implant. They are not, we will not go for any surgery, but they will implant some some type of pins inside, implant inside your brain. That is one, that is semi-invasive. Next, another type is non-invasive. That is another thing is non-invasive. Non-invasive means here that particular person here we are unable to they will just keep on the brain, but there is no, they will not implant anything on the inside the brain. That is called as a non-invasive BCI approach. That is another type of approach. These are the three different type of approaches. One is invasive, another one is semi-invasive, another one is non-invasive. Here, in the invasive means some surgery, semi-invasive means some implant, non-invasive means some MRI, EEG. These are the things we are going to use. Now, invasive brain computer interface. What is invasive brain computer interface? Invasive BCI involve implanting electrodes. Already I just now discussed. So we have to implant some type of we have to implant electrodes directly into the brain. That is called as a invasive BCI. What are the applications of invasive brain computer interface? Restoring motor function, example, controlling prosthetic limbs for paralyzed individuals, therapeutic uses, advanced communication for locked in patients. In that particular cases, we have to use this invasive brain computer interfaces. Next, another one is semi-invasive and non-invasive. Semi-invasive means electrodes are placed under the skull but not inside the brain tissue. This is called as semi-invasive BCI. Electrodes are there that are placed under the skull, but not inside the tissue. This is called as under the skull, but this is called as semi-invasive. This is called as semi-invasive. Provide better signal quality than non-invasive BCI. This provides better signal quality than non-invasive. Why? Because here we are implanting this particular electrodes inside the brain, but that is not we are not going for any surgery, but just we are going to implant that particular electrodes inside the brain. Now, application: epilepsy monitoring, early stage prosthetic control research. In that particular application, we use this particular semi-invasive BCI devices. Next, another one is non-invasive BCIs. What we are doing now, whatever the applications we are using that are non-invasive BCI. Non-invasive BCI means we are not going to implant anything on the brain. We are not going to implant any electrodes under the brain or under the skull, or just we are going to use that particular EEG device over the surface of the skull. We will touch that particular cap with the your brain. So that is called as non-invasive BCIs. It use external sensors like EEG, FNIRS to record brain activity through skull. Next, here, safe and widely accessible. It is safe. It is very safe. There is no problem with this type of non-invasive BCI. Why? Because it is we are not implanting anything under the brain. So that's what it is very safe. There is no problem with this type of BCI. There is no problem with this type of BCI. That is the one advantage of this particular BCI. Next, importance in various applications. What are the applications we are going to use in this particular brain-computer interface? What and where we are going to use? In effective computing, one is the area. Mental health monitoring. This is a very much interested area, which is aligned with our FDP, which is our topic of the FDP. So, mental health monitoring. For example, one particular person yesterday, most of our speakers discussed regarding sleep monitoring. Yesterday, Ganesh Nayak, and previous second day, our Bapiraj sir told that here they discussed regarding sleep monitoring discussion. So, so in that cases, some psychological or some mental related problems, we use this particular EEG device. Mental health monitoring also, we can use this particular device, mental health monitoring. Next, another one is neurofeedback and self-regulation. So in the neurofeedback mechanism also, we use this particular device, neurofeedback and self-regulation. For example, to control your devices or prosthetics or something, we use this particular device. Next, another one is assistive technologies. What is assistive technology? This is also very important. Recently, we got one funding projects under SERB. Recently means in 2019, that is completed. Okay, but in that project, we are going to control the mouse without using brain-computer interface application. So in that, what we have to do, we use the same EEG, and that EEG will take the data from 32 channel EEG, and we pre-process the data, feature extraction. Then after that, that will be translated into the commands, and without without any person who suffers from neurodegenerative problems like ALS or any problem, who cannot move his hands or legs or what, in that case, we can use this particular applications. These assistive technologies can be useful. Next, human robot interaction. This is also human machine interface, where here one particular person here, he directly without giving any signals, he will directly inform to the he can control one particular devices. Another one is market research and advertising. So this is also one of the important area we can use EEG. So you may get the doubt that, sir, how we can use this brain computer interface in market research and all those things. So anybody got any idea how we can use this brain computer interface in market research? Anybody? Anybody? So we have one device that is called as eye tracker. The eye tracker means it detects the movement of the eye, where we are looking, at what time we are looking, how much time, how is our perception about that particular thing. First, in a human psychology, what is the first thing generally usually react to the to our interested things? Our eyes usually reacts. So if we look at that particular thing more amount of time, that indicates that you are interested in that thing. So in that way, the market here they will analyze that here you are interested in that particular product. So in that way, we can utilize this brain-computer interface in market research and advertising. Next, education and training. Usually in education and training, also in virtual reality, in augmented reality, also we can use by integrating this brain-computer interface with augmented reality, virtual reality. We can use this particular brain-computer interface devices. Next, another one is entertainment and gaming. In the entertainment and gaming, also we can use this particular devices using what just now I told, augmented reality and virtual reality. Next, clinical diagnosis. Clinical diagnosis also we can use. So in clinical dialysis, mental rehabilitation centers, we can use this particular devices, BCI devices. Another one is stress management. In stress management also, we can use this particular device because it can identify your signals, EEG, it can identify your stress levels as well as your sleep, your physiological signals. It can easily identify, and we can easily find. Participants, some participants are. Who is that? Okay. No. Okay. Now here, our next topic is how this BCI works. And the BCI, how it will works mean, it will not directly take the signal from your brain and it will not directly give it to the computer. Not like that. If I am sitting in front of our computer, it will not directly take the signals from my brain. If I keep one EEG device, it will not directly take from your brain and it will not give it to you the computer. It's not like that. So we need some methods and some paradigms. That methods are called as paradigms. That paradigms we have to use here.
Plus minus क्या होता है? आपको मालूम है क्या होता है?
Yes, yes. Participants, please mute your mics. Now BCI paradigm. So what are the methods we can use to identify? What are the methods we can use? That methods are called as paradigms. Paradigm is a method to identify the signals in the brain. So we have to follow some procedure or method to detect the signals in the brain. So that is called as a paradigm. How and what type of data will be recorded. So there are different types of paradigms we normally have. One is SSVP. That first one is SSVP. That is steady state visually evoked potential. Next, second one is motor imagery. Third one is P300. Fourth one is hybrid. So first one is steady state visually evoked potential. Second one is motor imagery. Third one is P300. Fourth one is hybrid. Hybrid means the combination of any above two methods. So first, I will discuss about what is steady state visually evoked potential. So steady state visually evoked potential, shortly we can call it as SSVP, where EEG signals recorded is the direct resultant of the visual stimuli presented. So there are some visual going to be present on the screen. So for example, it's like blinking, just like it is one particular thing is blinking on the screen. Now it is flickered with some frequency. It is if you take anything, you have a screen in front of you, it will just here it is flickering. For example, it is flickering, then it what frequencies. So there are different flicker frequencies are there. So if you look at one particular flickering frequency, that results one type of signal. If you look at another flickering frequency, it will generate another type of signals. That is the like that we can extract the signals. That is the steady state visually evoked portions. Visual stimulus will flicker at a different frequency in alpha range, and this allows separation of the stimuli. So that is called as a steady state visually evoked potential. So now this particular thing, whatever the signals are there, that will be flickered at different frequencies. That will be flickered at different frequencies. That frequencies here you can classify. That is called as a visual steady state visual evoked potentials, SSVP. So the advantages, it is SSVP, no training needed. That is the first advantage. Not much training is required. Second one is it is high accurate. Second one is it is high accurate. Disadvantage. Coming to the disadvantages, here irritation due to flickering stimulus. So if, for example, if anything flickers, that means blinking. Flicker means it is blinking with some frequencies. For example, here it will flicker with like this. Something flicker with some frequency like this, some flicker with some different frequency. Anyway, one patient is also a patient. Only patients can use this brain computer interface devices. If patient sitting in front of that flickering and if you see that particular device or that flickering machine, then what will he feel? Usually feel irritated. So that is the one major disadvantage of this particular SSVP paradigm, and also high latency. Next, another paradigm is motor imagery paradigm. Motor imagery is a simple paradigm. So just now we have discussed where one particular person imagine is closing. Right hand is closing, and releasing. When he feels or imagine or visualize, if he is closing that hand, it will generate one particular type of signal. If he imagine is opening his hand, it will generate another type of signal. In the similar way, if he imagine his left hand closing, it will generate one particular type of signal. If he is imagining his left hand is releasing, it will generate another type of signal. So this is called as motor imagery signal. Regarding advantage, it is less time taking in term of training. It takes less time for the participants, those who are under experiment. That is a one advantage. Next, it provides more realistic approach. It is a realistic approach. Why? Because even though he is a patient, visualization is not a problem for him. Just he is visualizing that I'm moving my left hand, moving my left hand, moving left hand. Just visualizing that left hand, and visualizing right hand. I'm moving my right hand, right hand, right hand. So there is no problem with this type of method. Disadvantage: motor imagery has high latency due to dwelling time. So because of some, why? Because he has to imagine. Visualization will not happen within short span of time. It will take some time. If you want to visualize something or some thing, it will take some time or some minimum some amount of time. So that is the major disadvantage of this motor imagery paradigm. It is visually here, it is shown like this. So left hand, right hand, left foot, right foot is visualizing that. I'm opening my left hand, I'm opening my left hand, opening, just he will visualize left hand. And I'm moving my right hand, moving my right hand, moving my right hand. Like that, he will visualize. I'm moving my left foot, I'm moving my left foot, is visualized like that. I'm moving my right foot, I'm moving my right foot, like that also will visualize. So based on that, it will generate some signals. Now, here I am going to give you one best example of motor imagery paradigm. Look at this. Just is visualizing. Nice music. But what we can extract from this video is that one particular here one person is there, is unable to.
ಎರಡು ತಾಸ ಅವ್ರು ಹಾಕಿ ಹಿಡ್ಯಾಕತ್ತಿರ್ತಾರ ಹೆಂಗ್ ಸಿಗ್ತಾನ ಹಂಗ್ ಚೇಂಜ್ ಮಾಡ್ಬಿಟ್ರ ಇಡೀ ದಿನ ಅದ ಆತು.
Yes, here is visualizing that he is moving a right hand, moving left hand. So when he is visualizing about that he is moving right hand, means this particular machine or that particular thing, it will move this way. Once again, you just look at this. Okay. Next, another type of paradigm is P300 paradigm. So what is P300 paradigm? This is also called as oddball paradigm. So it is a positive deflection in the signal after about 300 milliseconds of the presentation of the stimulus. P300 means a deflection after 300 milliseconds, which is positive. P indicates is positive. And some another type also there. N is also there. N means negative. P means positive. If you observe this, any odd thing happens. For example, suddenly some person just shouted. What will happen? In my brain, there is a huge spike in the signal. Why? Because that shouting is odd to me. Anything which is not a normal thing happen, usually there is a spike in your spike signal in the brain. So that is called as a P300. Here, what is P300? Just now I given one example, but that will not happen naturally. Why? Because no one will shout and give a deflected signal, positive P300 signal. It will not like that. So we add some different experiments are there. What is that? In that one is oddball paradigm. So here there are different things will happen. In that, one odd thing also happens. When odd thing happens, your brain reacts, or in your brain, some deflection will happen. So that is called as a oddball paradigm or P300 thing. So this P300 paradigm is mostly oddball paradigm, where this positive deflection is the result of the identifying the target among distractors. Next, P300 advantages. It is high accurate, as well as training is not required. Training also not required. Much training is not required, and moreover it is high accurate. So what are the disadvantages of this particular method? So it is time consuming paradigms. User has to focus on the selection of array, long time for classification of P300 responses. It is a time consuming. Why? Because normally odd things will not happen regularly. So this is P300. Hybrid BCI paradigms. Hybrid means combination of two or more paradigms. That is called as a hybrid paradigms. Hybrid paradigms are typically used to do more complex tasks in less time. So if it's not works with only one type of particular paradigm is not suitable for that particular application, we can mix for our convenient. What is the problem in that? We can easily mix the different paradigms. That is also hybrid paradigm. Hybrid paradigm disadvantages. Hybrid BCI paradigms provides better accurate than the individual paradigms of the hybrid. Hybrid paradigms can be used in more complex tasks. Hybrid BCI paradigms provide better accurate than the individual paradigms of the hybrid. Hybrid paradigms can be used in more complex tasks. So what are the advantages? Hybrid BCI paradigms are more confusing and difficult to train the individual paradigms of the hybrid. So here hybrid of look at here. SSVP as well as P300. Both are hybridized. Look at here. This is regarding hybrid BCI. Hybrid means we can use two or more paradigms. It is a combination of two or more paradigms. That is called as a hybrid paradigm. Now, how this BCI can be used in natural language processing? There are different applications are there, but in our topic, we are going to discuss about natural language processing. Natural language processing means processing of the natural signals. What are the natural signal? Speech, okay now, words, these are the natural signals. So here there is a signal acquisition. Usually you take the signal from the brain. For that we use EEG device. Then the signal will be given to one classifier. We have to train one particular model. That model gives some classification that again will be translated into words. They where natural language processing comes into the picture. Brain signal that can be translated into the words by using natural language processing techniques. Here I am not talking much about the natural language processing, but how we can use BCI in natural language processing applications. So this review paper published in IGI Global Publishers, along with my BTech UGR students, we have published one paper in this concept. So here, this is the brain signal. This brain signal will be acquired through EEG. That will be given to the classifier. This classifier will be given to one particular signal processor, and that will be converted into the text. Now, look at here. This person is unable to speak, unable to write. Is unable to write. Why? Because it's just simply is suffering from neurological disorder problem. Let us assume that. Now, what we have to do? We have implanted one particular EEG device here. We have implanted one particular EEG device here. That EEG device, and what it will do here, that EEG device here, that will be translate is signals, thoughts, or is thoughts into commands. What are that commands? That commands in the form of text. That is called as a brain to word. That is called as a brain to word. Here, brain signals that will be translated into the word. That is called as a brain to word thing. Now, here, this will be translated into the words. A means, for example, A. Slowly, it will write B. It will write C. It will write D. It will write D, E, F, G, H, V, U, H, I, J, K, L, M. Like that, it will write. So this is regarding natural language processing. Now, in a similar way, we can use this brain-computer interface in assistive technologies also. In assistive technologies, what are the assistive technologies we can use here? Now I told that in the control of mouse. In the controlling of mouse also, we can use this particular brain-computer interface. So here, first, what we will do, we will capture the brain signal. If it is a real time, we will take from the EEG device, or if it is a simulation part, we have to take it from the existing data set. Then after that, we use signal processing algorithm, which is very, very important. Then this signal will be given to some signal processing algorithms. Signal processing means some artifact removal techniques. Where we use some artifact removal techniques. Then feature extraction. Feature extraction means here feature extraction. Then after that, classification. Then your application interface. Then followed by which can be given to some devices. This is called as a implementation of your thing. So we can control the devices. We can control the devices like smart home, robotic arm, wheelchair, drone control, web console control, etc. So with this, we can control the external device here. So in that way, we can use this brain computer interface in assistive technologies. Here methodology. For that, we use capturing of brain signals. We take some existing data set, which is from BCI competition data set 2A and 2B. So 2 days back, Rahul Chaurasia sir told that the begin for the BCI experiments or BCA work, we have to start with some existing data sets. Existing data set in that one standard data set is BCI competition data set 2A and 2B. I think Shankar asked this question. Shankar is there? Next, after that, we have to capture the signals. Then we will apply to signal processing algorithms. Then feature extraction. Then classification using MDNN algorithm. Then we will give it to the application interface. Then we will give it to the application, which can be used to control the cursor. So for that, we use some in the pre-processing stage, we use some filter banks. So this work done by our research scholar Srinath. So he published several papers. We, along with my scholar Srinath, have published some papers in this. One is there we have to use some filter banks, FCIF algorithm for class iterative filtering. There we have to use. So in that modified deep neural networks, we have to use as a classification technology. A modified DNN classifier used for motor imagery classification with 4 class FBCSP features. The deep neural network architecture is adapted to handle the input data from FBCSP. Designed for efficient and accurate MI signal classification. We have proposed one method. The advantage of the proposed method is which is the efficient and accurate for MI signal classification. Then convolution layers for spatial feature extraction, fully connected layers for high level feature learning and classification, dropout regulation to prevent overfitting. So in that, we need to use pre-processing algorithms which can remove noise and artifact from EEG signals. We use some feature extraction techniques which can extract discriminative features per classification. We use modified DNN classifier, classify pre-processed signals into motor imagery tasks. And after that, we need to train the classifier on labeled data. Testing, evaluate the classifier's performance on unseen data performance. After that, performance evaluation, analyze classification accuracy and other metrics. So this is the workflow diagram. In that, first we have to pre-process the data. Then we have to take the feature extraction. Then followed by modified DNN classifier. Then training. Then testing. Then performance evaluation. So these are the steps in implementation of modified DNN classifier for cursor control. So for that, the data set that we have taken is from BCI competition for dataset 2A and dataset 2B. It can be downloaded from this website. You just check or copy this website www.bbci.de/competition/4. Then here how we have taken the dataset. The dataset is the description of the dataset is here we have taken from 50 individuals. Participant met inclusion criteria such as age, cognitive ability, and absence of neurological disease that we have taken care. This is actually existing standard data set. EEG, next after that, experimental setup and protocol testing. Emotive insight and EEG, emotive insight EEG headset was used for data acquisition. It has 5 EEG channels, which consist of 128 Hz sampling rate and built-in amplifiers. Dry EEG electrodes were used. The headset also includes accelerometers and gyroscopes for capturing head movements. So these are the EEG signals when we are captured from a brain. These are the results we got. There are 4 classes. Why? Because we use motor imagery. There are 4 classes: class 0, class 1, class 2, class 3. Class 0 indicates right hand. Class 1 indicates left hand movement. Class 2 indicates foot. Class 3 indicates tongue. Now, class 0 predicted 197. Predicted class 0, 197. Predicted class 1, 1. Predicted class 2, predicted class 0, 3. So actually, if it is a class 0, means it is predicted 197 as it is. Instead of how many samples here? 197 plus 3, that means 200. So only these 3 samples are wrongly predicted as a class 1 and class 2. If you look at class 1, that means left hand movement. Left hand movement. Here, predicted class 0 is 2. In that, predicted class 0 is 2. Predicted class 2 is 1. Predicted that is false. Predicted class 3 also 1, that is also false. Predicted class 0, 2, also false. Why? Because it is actually class 1. Hence, 176 exactly predicted. Next, coming to class 2, that means foot. So here, class 1, class 0, wrongly predicted 1, class 3, wrongly predicted 1. Class 3, tongue, that means it is predicted 0, predicted class 0 as 0, predicted class 1 as 2, predicted class 2 as 3, predicted class 3 as 185. So these 5 samples are wrongly predicted. This is called as true or false negative, false positive, sorry. Now, experimental results. So if you compare with our existing DNN, deep neural networks, as well as modified DNN, so there is a accuracy is almost same, precision also same, recall same, F1 score is also same. Now, proposed modified DNN. If you consider modified DNN, then compare with DNN, here the accuracy 98.575, SVM baseline it is 95.2, KNN baseline 93. So there is a much difference between SVM and modified DNN. Here, this is the comparison performance with other existing methods like SVM, KNN, CNN, LSTM. These are the, when we compare with that, the accuracy is here, this is our modified DNN, existing DNN, SVM, like this, there is a comparison in precision also. This is the first flow graph, it shows accuracy, second one precision, third one is recall, fourth one specificity. Next, performance comparison. Regarding performance comparison, here we have different methods there, which is 95% in modified DNN, DNN, as well as CNNB, like that. There are different methods. Then compared to experimental results. These are the experimental results. This is the cursor. Here cursor position, cursor traces, average trace, trial 1, trial 2. So this is the thing we have, what we have observed from the graph. So this is regarding application of brain-computer interface using modified DNN algorithm. So here usually we'll get good results. Why? Because we have used some advanced modified DNN algorithms. So this is work done by our scholar. So the here our proposed method is also having some strengths as well as some limitations. The strengths, coming to the strengths, it has high accuracy, efficient response times, balanced revolution metrics, robustness. These are the strengths of our proposed model. Next, coming to limitations, it needs further research on personalization, long-term usability, and the user interaction enhancement. We need to do some user interaction point of view. We have to think about that. So this is regarding strengths and limitation of our proposed model. So challenges and future directions. So usually it is non-stationary artifacts and mode mixing. One is there is a future research also there in artifact removal techniques and enhancing machine learning algorithms for different application. Of course, anywhere we have some future development, even though if we do some 99, also 99.9% also there is a chance hope for 1%, 0.1 improvement. There is always hope for improvement. So even though not only in the direction of pre-processing in terms of feature extraction, classification accuracy, and application point of view also, there are different things will be there. Yes, dear participants, are you able to listen my voice? Yes. Lakshman.
Yes, sir.
Okay. Audible? My voice is audible?
Yes, sir. Yes, sir. Everything is clear, sir.
Clear, huh?
Everything is clear, sir.
Okay, thank you, thank you. So now coming to, we use 4-class iterative filtering and 4-class filter bank, common special filter pattern for EEG signal processing. Then the classifier design is utilize a modified DNN network for motor imagery classification, train and validate the DNN for accuracy and speech in cursor control. Then coming to feature extraction, apply FC, FB, CSP for feature extraction, capturing discriminative features for real-time tasks. Integration and testing, we integrate FC IF with the FC FBCSP and the modified DNN into a comprehensive BCI system. So here we used some deep neural network method, and then we have perform better results compared to the existing methods. And this is regarding one of my scholar work. Just we have recently is going to give his presentation on next week, most probably. So almost his work completed, and is we have published in so many journals our work. These are the papers we have published in this work. Nowadays, one is IEEE conference with a title of EEG-based motor imagery BCI using 4-class iterative filtering and 4-class filter bank common spatial pattern. Paper 2, we have one book chapter which is published by elsewhere. Artifact removal techniques in EEG data for BCI applications. That is also another work. Next, another paper, Journal of Scientific and Innovative Research. So these are the papers we have published along with Srinath, here myself. So these are the different papers. He published one SAIQ1 journal also, which is in SAIQ1 journal, Helian, published by Helian elsewhere publisher, with the title of Artifact Removal and Motor Imagery Classification in EEG using Advanced Algorithms and Modified DNN. And he submitted one paper for IEEE Access with the title of Enhancing Real-Time Cursor Control in Computer Application with Deep Neural Networks. So this is regarding my presentation. Any doubts or any questions you can ask me now. Any doubts, participants? So there is a lot of scope for improvement of this particular algorithm. There are mainly there are two things. We can do this BCI applications in a real time. One more thing is we can do this BCI application for simulation, and we can propose some algorithms, and we can improve the accuracy as well as some removal of artifacts. That way also we can do the research. So based on your comfortability, you can choose the your work. One is hardware part, another one is simulation part. Nowadays, everyone is using simulation part only. Hardware means as academicians, it is very difficult. We have to spend much time. Now, recently, we used Arduino board to integrate our EEG machines. To integrate the EEG, this EEG with Arduino, we developed some brain wheelchair control. Recently, we have published one patent also on this. So all those like this. So any particular model, we can do research at any particular point, any particular block also. Here, if you take this pre-processing, here you can use some algorithms and some artifact removal techniques, some eye blinks, some which are unwanted signals are there. The signal you can remove. Here also, you by using filtering techniques, something. That is one thing. Next, feature extraction also you can do some. What are the features you have to select? Why you select that particular features? Nowadays, most of the topics are on explainability explainability AXAI. That indicates that why you have taken, why this result you got, on what basis why you did internally, why you get these results, what are the advantages of this, why you have chosen model like this. This is called explainable AI. So you have to explain the things, whatever the results you got, why the result you get like this, that you have to explain. What are the model you have chosen, how that model chosen like that, why you got that accuracy, because of which parameter affected, how much, that you have to explain. That is called as the explainability AI. So why you have selected this feature, what is the impact of that feature on the result, that you have to explain. So that is called as explainability AI. Then after that, we have to anyway, we use some classification algorithms are there to classify the signals. There also one research area. Next, another one is that will be translated in the comments and then give the feedback mechanism. Yes. So this is from my side. Participants, any question? Any questions, participants? You can chart. Sir, okay. Thank you, one and all. Sir, Roshan sir joined our session. Next session by Roshan sir. I think I have to unmute Roshan sir.
Hello, good evening. Good evening, all.
Good evening, sir. Good evening,
Good
sir.
evening, sir.
Welcome to the
Yes.
FDP AI innovations in healthcare and medical technology, sir. Thank you very much for accepting our invitation, sir.
Yeah, thank you, sir. It is a pleasure for me to
Sir, I
participate
would
in
like to
this
give
event.
you a brief introduction about your profile, sir. First, then later
Yes.
I will hand over to you, sir. First,
Yes, sir.
can you
Can,
turn
sir.
on your video, sir, if you don't mind? So,
Yeah,
for our
fine, sir.
photo.
Yes, fine, sir. I'm coming, sir. Just a while, I'll be loading. I don't require any mails and any disturbance, so I'm just closing. Attendee screen sharing is disabled. Can you give me rights?
Screen sharing, sir? Okay. Screen sharing.
No, what you want? You want me to share the screen or just
No,
video
no.
on?
You turn on video, sir. Turn on video.
Okay, video is on, sir. Video is
Video is
on.
on, sir. Okay, 1 minute, sir.
Yes,
Sorry.
yes. Yeah.
One. Yes, sir. Thank you, sir.
Yeah, thank you.
I will give you a brief introduction about today's our speaker, Dr. Roshan Joy Mortis. Sir, Dr. Roshan Joy Mortis is working as an associate professor in Department of Electronics and Communication Engineering in Manipal Institute of Technology, Bangalore. So present, sir, academic responsibilities are undergraduate teaching, research and research supervision. Sir is expertise in biomedical signal processing, biomedical image processing, machine learning, artificial intelligence, optimization, computational analytics, data engineering, general research methodology. So here we are really happy, sir, like you person accepting our invitation. Why? Because most of your topics are research interests are aligned with our FDP for T. Thank you
Yes,
very
sir.
much, sir, for accepting our invitation. And regarding publication, sir had a lot of Scopus as well as SEI indexed papers. Here, I had a lot of Scopus indexed as well as SEI indexed papers. So, and Sir did his postdoc abroad. Sir had 86 documents indexed by Scopus as well as SEI. So the number of citations by in the Scopus records are 5,237. It is really a very good number, sir. We are really glad, and sir did his postdoc also abroad. Thank you very much, sir, for accepting our invitation and giving us a today's speaker. Sir. Thank you very much. Sir.
Yeah, thanks a lot for such a nice introduction of mine you have given. And yeah, I'm specialized in artificial intelligence applied to biomedical engineering and signals, images. I had extensively worked with regard to machine learning algorithms, deep learning, as well as artificial intelligence applications. Now, these all these applications were at, again, yeah, screen sharing is disabled, sir. Yeah.
Screen share, 1 minute.
Yeah. So meanwhile, yeah, artificial intelligence was an old topic, maybe around 1960, 1970 it started. But our computers were not that developed that time. So most of the AI research or machine learning or any automation research remained as a theory, but there were no practical systems because we have not advanced in the technology that time. But however, over time, we got faster computing facilities and fast processors also we got. And today we have GPUs and so many millions of computations, gigahertz speed computers, even more than that are available. Even there is a development towards quantum computing, so which will offer even higher scaling in terms of computation and in terms of time. So that resulted into these theoretical aspects which were discussed theoretically earlier have been a reality and they have been realized in practice. So in this FDP, I hope all the participants had gone through all AI methods, artificial intelligence, then data science, data handling, even machine learning algorithms, etc.
Now you can share your screen, sir.
Yeah, that's what I'm trying. Yeah.
Now it is not possible, sir.
Yeah, possible. Yeah, I think it is done.
Okay, sir. Thank you, sir.
So you are seeing my screen, right?
Yes, sir. Yes, sir.
Okay. Yeah. So when these machine learning methods and artificial intelligence methods, they have come into real products today. And we have this artificial intelligence is extensively being used in healthcare. We have various devices which implement all these AI algorithms in quick time. Okay. And yeah, so human intervention is reduced in these while using these devices, and day by day our devices are becoming more and more autonomous, and they are made to monitor continuously about human health. And yeah, there are also some works people are doing, though they have not been completely implemented, like interventions. Like people want to develop AI systems which can do interventions in the human body. But all those works they have proposed, and it is in the theoretical level. At a day, tomorrow, or sometime, those also will come into reality. So as a result, it is some guiding regulation is very necessary in dealing with this kind of technology. So wherever human intervention, we have a lot of technology. People are held responsible for various lapses. But what to do if there is a if there is a issue with the machine interpretation and machine interventions? So in that context, we have ethical challenges in artificial intelligence driven healthcare. And we also require some regulatory monitoring and some regulatory norms we require to contain anything happens in AI driven healthcare. But as you see, there is nothing. Yeah, we will anticipate a lot, humans, and in every aspect we anticipate a lot, and we prepare some regulatory norms for every condition. But day by day, if you see, there will be new cases getting incident, and there's a need from the day-to-day new incidents. The moral what is learned in the new incidents has to be brought into the protocol. So that's where we have ethical and regulatory challenges in artificial intelligence driven healthcare. We require some guiding material, or we require some regulatory material which will guide how the healthcare systems should be when they are in autonomous mode, so that human life is very precious. and these artificial intelligence driven systems should help humans, and there shouldn't be any safety issues or any risks. Those risks should be contained. So in that view, there are a lot of ethical and regulatory issues in AI driven healthcare. Okay, so today's lecture I'll be discussing on these aspects. So first I will discuss 1 or 2 minutes on traditional healthcare. Then I'll move to integration of artificial intelligence in healthcare, then different levels of autonomy in AI-driven systems. Then I will also discuss on impact of artificial intelligence in future healthcare systems, then characteristics of AI-based decision support systems, and so many topics we'll be discussing. So application of AI in healthcare, one few examples we'll discuss, then some challenges in AI-driven healthcare, then possible solutions to adequately regulate AI-driven systems, and then we'll go through some ethical principles which are required in AI-driven healthcare, then some regulations in European Commission as well as in USA. There are some laws governing AI-driven healthcare. We also have Artificial Intelligence Act in Europe, and also we have medical device regulation. We also have data protection regulation, and which data should be available to whom at what time. All those measures are there. And also, during no one can anticipate 100%. As a result, what happens is some point of time, there will be some new incidents, and we never knew that such incidents will occur, but it occurred. So that moral has to be taken, and in what context that happened, that incidents happened, maybe death of a patient, or there may be an adverse reaction, there may be some issue while administering drug by the AI system. So that has to be contained as a new measurement in the existing protocol. So all these things we are going through. Legislative measures in AI-driven healthcare we are going through. So we are going through here some of the European Commission norms, then some USA norms, then some World Health Organization norms, as well as some Indian regulations are there. So all these things we are discussing. So we also discuss Indian policies in AI-driven healthcare systems also. So we'll go through this. Participants may find a little abstract now because I'm just giving an upper umbrella, and when I get down into particular problems and particular models, I think you will be able to appreciate this. Okay, so in between any doubts are there, you can always feel free and ask. And yeah, any doubts you can ask, and anything you want more elaboration, I can give over time. Okay, so can I move further? Yeah, so this already you have gone through in this workshop. So this is a traditional healthcare system, and where we have healthcare management system. It's a normal traditional one. Patient gets some problem, then he will go to hospital, then he will be giving his information in registration form, then he will consult the doctor, and during consultation there will be consent form for the particular treatment, or consent for taking the treatment, or just measuring the parameters, blood pressure or temperature or anything. So country-wise, the norms will differ. In India, if you go to a doctor, doctor will directly check blood pressure, temperature, interview you, and symptoms he will identify, and then he will give the course of treatment. But if you go to any foreign country, developed country especially, I lived in Singapore. Also, I was there for a few days in US. So there what they do is, before you consult the doctor, you have to give all your address, name, occupation, all the information, nationality proof also you need to give. So if you are an expat, means if you are going from India and working in a foreign country, when you visit a hospital, you have to swipe your identity card. For expats, it is the visa, And for the citizens, it may be there like what we have here, Aadhaar. Likewise, they have some IC proof there, identification certificate proof they will have. So that they have to produce, and they will swipe, and all your information will be linked, or when you swipe it, this will be linked to all your other information. So which will be helpful to the government at any point of time, where they will know all the information is available, and whenever they want to communicate or take some action, or they want to analyze statistics to bring a new policy, it will help them. Then doctor will interview you, and actually doctor will see, and then he will explain you about your condition. He will have a bunch of sheets. If you have a stomach abnormality, he will just write the picture of a stomach, and there what is wrong at which place, that he will explain, and then he will prescribe the course of treatment. And if you have any doubts, you can discuss with him, and he will give you scope for that also. He will say, if you have any doubts, you can ask. So that way it goes. And since we have huge population in our country, and it is becoming difficult to maintain all those protocols, we are finding very hard to cater the healthcare needs with the existing specialists. That's the reason we don't have still. So if the healthcare improves, and if we have artificial intelligence driven systems more and more, then doctor intervention will reduce. As a result, healthcare can be given in a timely manner and in an efficient manner to more and more people. That's the need of AI driven healthcare. And yeah, once the patient consults the doctor, doctor can prescribe some tests, and he can get the results. Again, if he is sending him to for some test like MRI, CT, again there are also specific consents they will take, and then the doctor finally will diagnose, and he will explain what is your diagnosis and what should be your treatment. And patient has every right to accept it, or he can deny it also, or he can take an alternate opinion also. And it is the right of a patient to do that. So as per his knowledge and understanding, the patient can exercise any one of the three. So that is there. And yeah, he can go to a nursing home, then there's a pharmacy, doctor's prescription, pharmacist will issue medicine, biotechnology industry is there, samples can be preserved, and like tissue and all they collect from biopsy, that can be treated with different chemicals, slides can be prepared, and in the microscope it can be viewed, and appropriate analysis can be done. There will be medical devices, there is a hospital industry and pharmaceutical industry also, and there are various protocols in dealing a particular condition, but 100% human intervention is there. This is the traditional healthcare. Now coming to AI-driven healthcare, we are integrating artificial intelligence in the healthcare, where most of the things, artificial systems, artificial intelligence will take care. Only a few things human has to intervene. And here also there are 5 levels of automation, lowest to highest, 0 to 4. We have 5 levels of automation. Okay, so what is how the AI-based healthcare system looks? Okay, so we have a large population, public, and various social determinants of health. So from there, of course, patients consult, their family, community also will arise. So when a patient gets an illness, of course, he will be able to tell his symptoms, what is going on with him, and his attendants can also explain what is going on with him or her. So when there is an illness, the patient goes to the hospital, his family members also give information, he will also give, and sometimes it so happens community is also important. The thing is, sometimes one person gets some infection, maybe malaria. So he visits the hospital, doctor will give him the treatment, and whether in his neighborhood is there such viruses, because of which virus, bacteria. So that is also important to prevent well-being of others in the community. So patient, his family, as well as the community are very important. And with these things, if the problem is of community importance, then there should be a some protocol has to be brought down to reduce that. And you must have seen many times during rainy season, people will, this government officials or this government delegation will come and they will some smoke they will release, right? Some chemicals to kill all those bacteria and viruses. They take care of these things. So many things are there. Then ethics and legal issues are also there. Clinical informatics and health technology is there, in which we are specialized, and there is a scope of this FDP which you are undergoing. And health since, yeah, clinical informatics means when you deal with this data, and that needs to be stored, and at an appropriate time it needs to be fetched, and it should be connected to other data, and to map his health condition, what is his diagnosis, all those things. Then we have health system improvement. Depending on a new case, we will improve our healthcare system. Then teaming, when a person is having an illness, it may connect to multiple specialties. A person getting a heart problem, he also can have blood pressure variations, he can have sugar variations. So there are various departments specialized, and each department will give its opinion and what is the diagnosis, and they sit jointly and give you the final diagnosis. Then agency, management, advocacy, all these things are there. Population, public, social determinants of health, etc. are there. So I need not to explain this in detail. If you have any doubts, you can ask, I will explain further. So we have our own healthcare structure and process in India, and we also have leadership in this. So you can see there are different aspects. There is a teaming, there is a leadership, there is ethical and legal, and yeah, then also there is change, agency, management, and advocacy. Even government policy is involved, and you can see different areas have been mixed. We can see different gray areas where, of course, one expert can collaborate with the other expert in solving patient's problem. So this is collaboration is today's focus, even in healthcare, and so many specializations are required to cater healthcare in AI paradigm. Okay. Now, I was talking about different levels of autonomy in artificial intelligence systems. So suppose there are 5 different levels of autonomy. So if the level is 0, there is no automation, and only when there is level of 4, automation is highest. So at 0 level, it is a traditional healthcare system where there is no presence of artificial intelligence, and standard care is given, and human is the final decision maker. But there may be some automation in terms of registration of patients, maintaining his personal data, not healthcare, other things like his address, name, age, etc. And those things are there, and medical data also is stored there. Okay, in terms of files, or digitization is also possible here, in the sense fetching the blood test report, fetching the MRI scan, or fetching some blood test report for doctor's consultation. All those things are there, but there is no automated interpretation here. So presence of AI is not there. Then in some particular applications, after that what happened, AI suggesting decision to human.
Sorry for the
Yes?
interruption, sir. Sir, your slides
Yeah.
are not changing, sir. Slides are
Not visible.
Visible, but not changing. For starting slide only is there.
Slide. I'm explaining 5th slide. Are you finding?
Slide only showing, sir. You share the entire screen. That is better. Entire screen you share, sir.
Okay, 1 second. It's not shared, huh?
Yes, now it is okay, sir. Now it is coming.
Okay. Full screen you are seeing?
Yes, sir. Now you share, sir. Again share, sir.
One second. That's what. Yeah. So far things, could you able to see?
Sir, now you are not sharing any screen, sir. Now, okay, sir.
Okay. So now are you able to see the slides?
Yes, sir.
Okay. Now I will maximize. Are they
Change,
visible
sir?
now?
Yes, sir. Visible.
Huh?
Change, sir. Change the slide.
Okay. Is it
Yes,
changing?
sir. Fine, sir. Fine.
Okay.
Excellent.
Okay. Earlier it was not changing, I think. Okay, these things
Yes,
was visible, no?
Yes, sir.
Okay. So now I was discussing about integration of artificial intelligence in healthcare, where we saw there is patient, his family, community, and various interdisciplinary things. We have leadership, we have ethics and legal team, we have teaming to solve healthcare problems, we have change in agency, management, advocacy, etc. We have discussed healthcare structure and process. We have established protocols. Policy and economics are also involved. All those things we have discussed. Okay. So now we are discussing different levels of autonomy in artificial intelligence driven system. So the level 0 is minimum zero automation and level 4 is highest automation, and we have 5 different levels. So if level is 0, there is no AI embedded in the system, and standard care, traditional healthcare only is rendered there, and final decision is taken by human. Even the AI system doesn't recommend anything here. There is no AI, so nothing, recommendation is also not there. So if you go to level 1, AI suggests a decision to human. Here clinicians consider AI recommendations, but
Sir,
ultimately
one small request, sir. Now you are the
yes.
host.
Yes.
Sir, can you record this one, sir? This one recording option is there.
Is it? Okay. So 1 second. Yeah, just a while. Recording option. I think it is being recorded.
It is being recorded, sir.
Yeah, it is being recorded.
Okay, sir.
The
Thank
red
you, sir.
button is there. Okay.
Thank you, sir.
1 second. My sharing screen I'm seeing. Just a while. Yeah. Yeah, recording is there.
Yes, sir.
Yeah. Now
Thank
screen
you,
is
sir.
visible, right?
Yes, sir. Yes, sir.
Full screen is visible, no?
Yes, sir.
Okay. So without AI, we don't have any automation. Doctor will prescribe the test, patient will come out with those results, and based on that, doctor will decide what is the treatment. Now, if you go to level 1, there will be some extent of automation where artificial intelligence tool will act as an adjunct device or adjunct tool which will guide the doctor. Okay, so clinicians or doctor consider AI recommendations, but they will give, they can depend on AI solution, or they can again ask AI to check it again, or final decision maker is clinician only in this case. Doctor only is responsible to take the decision, but artificial intelligence will guide him, but decision is taken by the doctor. So next level, we have level 2, where AI makes decision with permanent human supervision. So here automation is little more. In level 1, automation was little less. It was giving as a adjunct tool and doctor can act. So AI makes clinical decisions on treatment and therapy with human doctors providing ongoing supervision. And if the doctor is comfortable with the AI tool, and if he has faith after observing for a long duration with that tool, he will just depend on that and he can approve what AI system says. And sometimes if he has any doubt in some borderline cases, he can check himself and he can give his decision. And such devices, such automatic systems are in the level 2, and it will increase with respect to level 3 and level 4. In level 3, AI makes decisions with no continuous human supervision, but human backup is available. Here autonomously clinical decisions are taken regarding therapy, treatment, etc. alert human users in case of uncertainty, minimizing the need of constant supervision. Here AI will take the final decision, but again, it is not fully automatic. Doctors will continuously supervise. Anything adverse happens, they will intervene, and they will not allow AI to do everything. So in the last level is fourth level, where AI makes decisions with no human backup available. So AI autonomously govern the clinical decisions with no human backup. So this has not come yet here in healthcare sector, but in other sectors it has come. In say insurance claims, stock market prediction, that AI can automatically make decisions. But in healthcare, this has not yet come. Level 4 has not yet come. Okay, here AI only will intervene and AI only will decide. And many times, different illnesses people will have. Say, many people consume opioids. It is against law, but still people consume these opioids or drugs. So there is a threat. Sometimes, yeah, every drug or every narcotic has its own negative effect. If they take once, they feel to take second time, and after some time they will get withdrawal symptom. If they don't get the next dose, then they will shiver, and many times they die because of not getting that material again. So in that case, what doctors will do is, if he comes to the hospital, they will give him some antidote, and with which his withdrawal will not come, and he will be revived, and he will be given appropriate treatment so that his de-addiction can be taken place. But for a modern world, there can be AI can detect that opioid withdrawal, and it itself can inject antidote for that, and the patient can be saved. And this has not come into practice. Nowhere in the world any legal system has given permission to this. Okay, this is yet to be realized in the world. And to realize this, we require more stable, more accurate, and more reliable AI systems with 100% performance. Then it will be a reality. Yeah. So what is the impact of artificial intelligence in future healthcare systems? So AI can impact everything. It can optimize resource allocation and prioritization. So what is meant by this? Okay. So with AI, respective resources, like we have doctor, we have various other infrastructures, patient registration, the data maintenance, histopathology study, even other blood test and routine checkup. These can be speeded, and we can optimize resource allocation and prioritization. Any emergency case we can direct, and normal case can be taken in the normal course. So shifting from hospital-centric to a community-based healthcare paradigm. What does it mean? Shifting from hospital-centric treatment to a community-based healthcare system. Most of you have seen during pandemic, this was realized. So when the COVID case in one place, immediately they contained it by community-based interventions. And when suddenly in some place new variant arised, so that time in that particular place they have done genomic test for few patients, and they identified what is that variant disturbing in that particular geographic region. Okay, so all those things were developed. Then extend clinical care outside the formal healthcare system. Yeah, so clinical care is outside formal healthcare system also carried. We have BP monitors, we have ECG monitors, we have sugar monitors, etc. And even we have continuous monitoring also in these things beyond healthcare system. They can themselves manage, and even patients can measure their glucose level. There are tools all of you are seeing every day. So don't have sufficient infrastructure, we don't have sufficient doctors, we don't have sufficient hospitals, and we don't even have sufficient wards. And even if you have everything, many people cannot afford. So government has to bring some protocol to revolutionize these healthcare systems where AI only can solve it. Okay, so these are some of the impact of AI in our healthcare systems. Okay, now what are the characteristics of AI-based decision support systems? So we need to collect, analyze clinical and non-clinical data as risk factors for disease development. For example, for heart disease, a patient is having heart disease, then they will check whether he is diabetes, whether he is having blood pressure, whether he is having cholesterol, and whether he is having any family history, whether he is a smoker, drinker, all those risk factors are there. They will map that and analyze, and he will come to a decision. What is the cause for him to have heart disease? So this way it is done, and yeah. So we have two kinds of systems, like diagnosis support systems and virtual care systems. Okay, and the interaction is depicted here. Okay, we can have predictive analytics, we can have prognosis systems or preventive measures. We can also, in virtual care, some people can participate and it's voluntary. Even the healthcare is personalized today. Earlier, what doctor was telling patient has to obey, but today it is not the case. Patient can ask what is going on with me. So particular to his question, the healthcare system has to address his needs. So in that case, personalized healthcare has come into existence. So we have virtual care system where healthcare is personalized. Virtual care means like he will have some continuous monitoring systems, like he can halter monitoring is possible, but doctor remotely will not check, patient only will see, and only in alarming case it can be automatically reported to the healthcare facility, or patient in the normal case patient can go through it, what is going with him. All those things are possible. Such systems are called virtual care systems. And yeah, diagnosis support system where we will predict the risk and we will prevent at early stage than increasing the health issues. So all these things are possible. So in predictive, you can collect, analyze clinical, non-clinical data as risk factors for disease development. You must have seen Framingham Heart Study where yeah, it will give you a questionnaire online. It is available, Framingham Heart Study, and there is one calculator available online. You can check your 2-year risk for heart disease, or you can also check 1-year risk of heart disease. So you can just enter that, fill the data, and it will say what is your probability or percentage risk in getting a heart disease in 5 years or 1 year, depending on which you choose. Okay, so this way you can predict the disease, you can prevent or prognosis the disease. So everyday life monitoring and self-management technologies for proactive preventive measures are possible. So all of you are aware, in India there are a lot of cancer cases. Okay, so how this cancer arises? Because of synthetic materials consumption, plastic usage of plastic, usage of polluted air consumption. So cancer, because of that, cancer cases are incident more nowadays. More cancer cases are being incident because of that. So in developed countries, they don't have this many cancer cases. The reason is they have their own biomarkers they check. For every cancer, there are some indicators in the blood. So the test they will do, and they will understand what is the risk and all, and they will prevent. So in India, it is very much necessary because cancer cases are increasing. So that should be detected at early stage, where we get this prognosis is required. So patient engagement and adherence to ongoing monitoring and support of the care process. So here we can make the patient engage in some technology. For example, one can teach how to use sugar monitor. One can teach how one can use blood pressure meter. and analyze their own health and in what conditions you have to come and report to the healthcare system. So these also can be taken, and it is a participatory. Individual can participate. And personalized means you are giving a customized or tailored solution for a given patient, where tailoring medical plans to individual patients based on comprehensive medical data. For example, nowadays you see there are many professionals or professionals who are busy in their work and they don't know how to control sugar, and some of them are diabetic. So there are some doctors who spend 15-20 minutes every day and guide them. This is what went wrong with you today. You have taken this particular food, because of that your level has increased. So they will guide, and even it is possible to reduce this treatment as well as consumption of insulin by finding the lifestyle and physical activity and other stress pattern management. So healthcare can be personalized, specific to the need of a person. Okay. So what are the applications of AI in healthcare? Some examples. One is care management. So I was just telling some examples how you can manage healthcare. Like healthcare can be personalized, healthcare can be preventive, or prognostics can be developed. There can be predictive analytics can be done. Patient can participate, patient can be given personalized solution, etc. We can do it with artificial intelligence. And medical imaging analysis. For example, we can have, this cancer can be detected only by biopsy. Biopsy means they'll take some tissue, tissue of the organ where there is a cancerous lesion is there, cancer tumor. From that they will take little tissue, and they will process it and make slides, and those slides are called histopathological slides. And with that, the pathologist looks the pattern in those slides and he will say it is cancer or normal. What if you come up with a automatic microscope which will detect cancer? It has to give a report whether you have cancer or not based on this slide. So likewise, we can also have ECG machines which are giving automatic interpretation. Nowadays they are in place. Okay, so AI can also be used in drug discovery, finding a new drug. Because of what reason cancer arises, why a person is getting cancer, what is the problem. So today we have gene patterning, like we have this double strand RNA, DNA, right? So in the DNA, there are patterns.
Your slides are not visible, sir.
Yes?
Your screen is not shared. Slides not visible, sir.
Okay. Just a while. Yeah, very sorry for the disturbance. Yeah. Is it visible now?
No, sir.
I hope it's visible, right?
Now okay.
Okay. Now it is visible. Just a while, I will go for a particular view.
Actually, shade screen.
Huh?
Screen shade. Stop shading, sir.
Yeah, that's what screen is shared. Screen is shared already.
Entire window.
Yeah. Okay, screen is being shared. Okay, so now it is visible, right? Whether screen is visible?
No, sir.
Okay. Screen is being shared. It is showing. Just a while.
Yes, sir. Now okay, sir.
Okay, now whether my screen is visible?
Yes, sir.
Slides are visible?
Yes, sir.
Now? Now slides are visible, right?
Visible, sir. Now you change, sir. Change slide.
Huh?
Change the slide.
Yeah. Yeah, I'm in the slides.
You are changing the slide, sir. Change.
Can you repeat? Yeah.
Yes, sir. Yes, sir. Correct, sir.
Okay.
Correct, sir. Fine, sir.
Okay. Yeah.
Right.
So drug discovery, we have discussed forecasting kidney disease. Then we can research and treat cancer also. We have discussed. We can also have precision medicine. Precision medicine means, for example, a patient is having cancer and he needs to be given with proper chemotherapy. So the cause of cancer has to be known, and human is having a lot of genes. And I was just explaining, we have this gene doubly stranded thread. We call it as DNA. In that we have ATGC, various genes we have, and depending on the pattern of these genes, there will be some expressions like phenotype, we call it as. Everyone will have some gene pattern, and because in everyone there are some tendency to develop cancer, but you require a trigger either by nature, like if you consume some plastic or some air pollutants, that time it will express, particular gene will express. Okay, so in that case only cancer gets expressed. So here in order to give the chemotherapy, particular cells needs to be targeted, and for that what we need to do is we have to identify pattern, and we have to identify what is that gene expression which led to this disease, and then chemotherapy can be planned efficiently, and this is a subject of precision medicine. So also we have AI based diagnostic. So today if you see, there is a FDA approved device for CT scan, where a patient is given anesthesia and he made lied on a CT table, and his CT is taken, and suppose he is having some cancer lesions in some organ. So what will be done is, based on the CT, the doctor can see the CT scan, and wherever cancer lesion is there, he can just click on that. Patient is given anesthesia, not to, because he shouldn't move. So once he clicks on the cancer lesion, immediately the AI algorithm build a boundary it will identify of the lesion, and it will show to the doctor. And same time, doctor has to verify it. If it is correctly segmented, then doctor has to give a node to insert the ablation needle. So in that case, in the next step, it will show some possible directions through which you can pass the needle, and doctor has to check it whether it passes through other vital organs or any blood vessel. And if it is not the case, only doctor has to confirm. Then once doctor confirms, that needle will be inserted to the particular point, and once it reaches the required lesion, there it will be then some radiation will be given, and because of that cancer cells will die. And once cancer cells die, the impedance of the body changes, and because of that, and after identifying that, immediately the ablation can be stopped, and that needle can be retracted out. So with this one can without any much intervention, without opening the body, just by inserting the needle, can cancer cells can be destroyed. Okay, so AI based diagnostic. Then health monitoring, we have different devices like we have this Holter monitoring, we also have sugar meter today, etc. So with that, one can monitor audible, right? And my screen is visible. Slides changing, you can find, right?
Yes, sir. You are audible, sir.
Okay.
But slides are not visible, sir.
They're fine.
Your screen not shared.
Okay, and my screen is visible?
Screen not visible, sir. Actually, you have not shared the screen. Now, once again, you share.
So privacy, maintaining privacy in data is very important. So only the data should be
share the screen,
should
sir.
be passed to. Okay, now also. Wait. Repeatedly. Yeah, 1 second. Yeah, my voice is audible. Yeah.
Yes, sir.
Yeah. I'm doing that. What is going wrong? I have to share my screen, but what is going wrong? I'm not able to understand. 1 second. Settings. Yeah, there is a current problem, but what is leading to that? I'm not sure. It's a Chrome, it's a window, it's an application, no? I'll share the window and see how it goes. Now it is visible.
Visible, sir.
Now?
Yes, sir.
Whether my window is visible?
Yes, sir. Everything fine, sir. Yeah.
Any problems? I'm seeing it is being. Your screen is shared?
Sir, everything fine, sir. Everything fine, sir.
My screen is visible or not?
Visible.
Visible, right?
Yes, sir.
1 second. Your screen is being shared. One second. The screen is being shared. Now, but it is not maximized. Huh?
Slideshow, sir. Slideshow.
Yeah, can you repeat?
Slideshow.
How to just maximize the screen, right? Visible, no? One second.
Press F5, sir.
Yeah. Second. Yeah. Okay. Fine. Somewhere I have to share this. Yeah, visible, I think, no? Okay. Yeah. Fine. So there are various challenges starting from data privacy, which I just explained. So there are challenges in collecting the data, storing them, and while storing. Yeah. Even while storing, we should have different protocols. Yeah, it is. One second. Yeah. Frequently it got disturbing. Yeah. Hope it is visible now.
Yes, sir.
Okay. So data collection and storage. While collecting the data, there are a lot of challenges. We need to follow some proper protocol, and even while storing also, we should also have some norms. How long you have to store, whom should be available at what time, and after how many years it has to be destroyed. So far, there are no standards on this, but some standards are being developed by IEEE and other agencies, where how data should be recycled, how long the data should be maintained, and which level it should be available, which level it shouldn't be available, and when to destroy it. So all those things, standards are not there, but it is being developed. And then quality of data is very important. If there is a noise inbuilt, it is difficult to interpreted. For example, of disease will be easier, and all the methods have given almost 100% of accuracy, and we have all automated ECG detection systems available now. But challenge is when the patient is in his own natural habitat, like he is moving, he's going, he's taking food, he's doing exercise. That time the data, he moves his hands, he moves his head, nodding, etc. And because of that, what happens is he will that EMG corresponding to that action will adds on the ECG, and as a result, there will be a lot of artifacts and even noise also in the ECG. So making them accurate detection is a challenge today, and it is being developed also. So the algorithms which give 100% accuracy for ECG analysis, clinical ECG analysis or the bedside ECG analysis, they will give 70 to 80% accuracy only. So these things has to be improved, and yeah, data should be made available to whom, and what is the accuracy or signal quality index. All those things are the subject of this topic. Then interoperability between different operating systems, like the decision support system should be compatible across different operating systems. Then one more aspect is bias. Bias means for a given condition, my machine is more favoring. In the sense, say I'm detecting some heart disease from the ECG, and I have 1000 normal data and I have only 100 abnormal data. So in this case, my algorithm gets biased to classify even the abnormal data into normal, because there is a skewedness in the data. So one category, there are more samples, and one category, there are very less samples. As a result, my decision is going to favor the majority class. So as a result, this is not accurate. So today we have various technologies like we have explainable AI, and also we have generative AI models. So generative AI models, what they will do is these 100 images which are abnormal and they are less in number, it will generate more samples which follow the statistics of this abnormal data. And with that, you can reduce the bias. Okay, so health equity. So health should be equally given to everyone. There shouldn't be any discrepancy to a particular category of people, and there should be fair practice. So this is another challenge. Then affordability and access to AI in developing countries. This is the case of our country, where we have a large population, very less number of doctors, less hospitals, and everyone cannot afford, and the cost has to be brought down, and healthcare should be made available for everyone. So this is the affordability and access problem in India. So it will help our country a lot. Maybe over time, government can adopt some of this technology with which the cost can be brought down. Currently, the patient has to come to the hospital or primary care center where the doctor will look him, and every day there are 150 to 200 cases for one doctor, and he will also be strained. So in between, there can be an automated system. There can be a medical persons who can train patients in using the technology. We can engage the patients in various technologies, and as much possible, we can normal cases we can solve there itself. Only there are very severe cases can be referred to the doctor, so that doctor's attention also improves on particular cases. Every case is not given equal priority, and with which the community can get benefited. Everyone will be benefited. That's the thing. And challenges, there are regulatory challenges, there is a governance challenge, there is ability to control third-party access to personal health data, there is a security issue, implementation of the technology, adoption, explainability, all these things are possible. Transparency, accountability will come. So there may be errors, there may be wrong diagnosis, there may be discrimination in dealing the cases with respect to artificial intelligence. That shouldn't happen. So all these are challenges that need to be overcome. Okay. Now, what are the possible solutions? So, establishing legally binding rules and standards under World Health Organization, and this has been taken, and there are a lot of regulations also in this. Okay, so regulatory oversight should be more strengthened. This means day-to-day new cases are being reported, and depending on the new cases, the new unforeseen issues are to be contained in our regulation. So day by day, regulatory standards are also getting updated. So regulatory standard means it's a standard. It is called a proper protocol with which you can a patient can be diagnosed, and other healthcare personals like doctors, nurses, paramedicals, etc., data entry specialists, etc. They follow a proper pattern, and in case of any breach or in case of anything happens to the human life, that also can be complied based on this protocol. So that's the reason we require a good protocol to contain these adequate fairness practice in AI-driven healthcare systems. Yeah, and promoting transparency and accountability is very much essential. Encouraging industry self-regulation is also required, and fostering international cooperation is also required. Then ethics in using personal health data, very important, as well as AI culture involving all the stakeholders. Hope I won't explain this individually. Partly it has come in my earlier slides. If you need, you can ask, I will explain. Hope all of you understood, right? Okay. So now ethical principles in AI-driven healthcare. So why we require ethical principles? Partly I've explained in my previous slides. Yeah. So transparency, justice, fairness are very much necessary. And in case of any breach, people are accountable, and also the person's safety will improve with this. It is not to punish people, but it is to give safety and performance to our systems. And safety of a person and life should have a lot of value. It is bringing these ethical principles is not to penalize some particular person, but it is to help the patient so that his life can be saved always, and there shouldn't be anything. We don't know even the particular the person who is part of healthcare system, he also may be saved at many times, and there will be a uniformity in the system. For that, this is very much required, ethical principles. So beneficiary are everyone, not only patients, but also the personal part of the healthcare also. So yeah, freedom and autonomy is required, trust, sustainability, dignity, solidarity, all these things explain the same thing. Okay. So promoting responsiveness and sustainability means when a patient goes, he should be contained always, and his query has to be resolved. Healthcare is personalized, right? So, and it should be a sustainable model. There should be accountability. This is at the end of the day, one cannot say it is none of, everyone can say it's not my work. That way shouldn't happen. So there should be a proper accountability, there should be a proper clarity, and respective individuals' responsibility should be met properly, so that our patients can get best care and they will not be lost always. And everyone will be given equal opportunity in this system. So it will promote wellness and safety of everyone, including patients as well as healthcare professionals as well. So it will ensure transparency and explainability also, inclusivity and equity, means everyone will be treated equally here, and everyone will be given healthcare facility equally. And anything happens, it shouldn't happen first of the, if we have all these things in place, and anything happens, then again that what moral learned from that particular case has to be incorporated in the protocol. So that will be brought. So there is autonomy in protection. Okay, everyone will be contained in that, and it will promote responsibility and sustainability. So this is ethical principles, and yeah. So based on these things, there are some regulatory measures taken in AI-driven healthcare. In Europe, there is a General Data Protection Regulation Act. It enacted in 2018. It is attributed as GDPR Act. Okay, here the data privacy, data integrity, and which data should be available to whom, and it shouldn't be misused. All these aspects are contained. And European Parliament also had one act which is called as Artificial Intelligence Act. It is effective from August 1st, 2024. And also we have medical device regulation. We call it as MDR. It is active since 26 May 2021. And prior to that, we had medical device directive and active implantable medical device directive. So these laws were there earlier, and now MDR has taken over these two laws, and they are now they are not in force. Medical device directive and active implantable medical device directive. Instead, we have a single directive called medical device regulation today. Then we also have clinical trial regulation effective from 2022. And also we have Health Insurance Portability and Accountability Act in USA. It is called as HIPAA, HIPPA, Health Insurance and Portability and Accountability Act. Just while there was a typo, it continued in the same line. It should be a different independent point. And we also have an institution called Food and Drug Administration. We call it as FDA. And in India, very importantly, we have Disha Bill, Digital Information Security in Healthcare Act. Okay. And it was proposed by Ministry of Health and Family Welfare. Recently it happened. Okay. So any doubts? Okay. So going further, we require a ethical governance system in artificial intelligence based healthcare system. Okay. So we require a good governance system to ensure proper AI based healthcare, so that everyone will get quality healthcare and there won't be any bias, and it should be there should be equity given to everyone.
Thank you, sir.
Yeah.
Thank you
Yes. Yes. Yeah. Can you? Yeah. Some concern somebody raised. Yeah. Some concern somebody raised.
That is myself, sir, Dr. Ravichandra.
Yes, sir. Yes, sir. Sir.
It is a wonderful session, sir. Actually, it's very informative.
Yes, sir. Yes, sir. Yes, sir. Fine, sir. Fine, sir. Yeah. So as I was telling, ethical governance system is required in AI-based healthcare systems. So we have social needs, and based on that, we have an upper umbrella. We call it as ethics. So we call it as ethics. Okay. So that has to be kept in view first, and everything is designed under this umbrella. So when you design certain things, we foresee most of it and we will implement. And later few years, we certain things happen which we have not foreseen. So as a result, based on that situation, our regulation gets updated. So ethics is a larger umbrella under which there is a implementation and under which there are ethical norms. Okay. So there are social needs. Based on social needs, ethical values are derived. Then based on ethical value orientation, we have ethical values as a top level design first. Then below that, it will come the research, then ethical principles. Ethical values are always a upper umbrella in which we have principles. We have to teach the healthcare professionals. We have to teach all stakeholders. For that, we should have ethical values. And in order to convince everyone, we require ethical principles. And to enforce, of course, when you have ethical principles, everyone can have a different interpretation. To have uniformity in the interpretation, we need an ethical norm. Norm is the bottommost thing. And above that, we have ethical principles, which are derived on ethical values. And it is applicable in all regulations for all things, not only our healthcare, but always. Okay. So yeah, in ethical principles, we have detailed values, then assessing prediction and ethical issues, drafting ethical principles and guidelines, etc. are possible. Then multi-participation and international cooperation is also required. Just I discussed European Commission laws as well as US laws, some acts we have seen, Artificial Intelligence Act we have seen, Data Protection Act we have seen, then we have a FDA, etc. All those things we have seen. So yeah, they are the bodies and there are established principles. Now, how to regulate them? There are ethical norms. Every agency has an ethical norms. Okay, so that way we have this ethical governance system in AI-based healthcare systems. Okay. Any doubts? It's a very broad thing. It itself can take one session. Okay. Okay. Now, in India also, there are some policies in digitization of healthcare, which is adopted by our own government. We have Drugs and Cosmetics Act. We also have Information Technology Act, Clinical Establishment Act. We have other so many acts, DNA Technology Act, etc. You can just go through. Any doubts you can ask. Yeah. Yeah, I have these many things I have, but I have not explained some case examples, and I have not explained in depth, in detail, with applications. I covered as an upper umbrella, and now I want you to ask any doubts, or if you want more elaboration, I can do on any aspect. If you want some examples, I can give. So the session, I will keep it open for interaction. Any specific doubts are there, you can ask. Actually, in any presentation, I feel presentation is one aspect, then interaction has a greater role to play. So like we have upper umbrella in ethics, then ethical values, then we have these norms. So likewise, this is upper umbrella, and if you have any doubts, we'll look into it. And yeah, if you have any concern on any topic, we'll elaborate. And if required, any more examples at any stage, I can. I want active participation of all participants. Yeah, you are free to ask anything.
Yes, participants, you can ask questions. Sir is open.
Yes. Yeah, you can ask anything related to ethical principles and regulatory norms. Of course, regulatory affairs, which is a larger umbrella in AI-driven healthcare. Yeah. I think I winded a little early. And any concern is that I can address. Yeah, the house is open for discussion. It's an important thing. It has to be followed until we have a completely accurate and 100% fault tolerant system in healthcare. We require these things. Regulatory norms are very essential. Yeah, that's all from my end.
Thank you very much, sir.
Yes,
In spite of your busy schedule, accepting our invitation, sir.
Yes, sir, no problem.
Your
I
session
thank.
is wonderful, and
Okay.
your session given information regarding AI in ethical and regulatory schemes. Sir, thank you very much for your wonderful
Yes, sir.
presentation,
Yes,
sir. We have
yes,
small valedictory session, sir. Please be in
yes, sir.
the session, sir. Just for
Yes, sir.
15
Yes, sir.
minutes, we will close the session, sir. Entire thing, sir.
Yes, yes, sir.
Now I will.
And I
You
also
just.
thank. Yeah, I also thank the organizers and especially SR University for giving me an opportunity and platform to present in this session.
Okay, thank you, sir.
Okay, okay, thank you.
Sir, once if you can stop share
Yes, sir.
screen, sir.
Yeah. Sir, half?
Stop share screen. Use.
Okay, sir. Okay, sir. Okay, sir. Done, sir. I think there are some messages in chat.
Yes, sir.
Yeah, there are some disturbances. Okay.
You make
I
me as a
just joined
co-host,
on
sir.
the browser.
Sir?
Yes, sir.
Roshan, sir. You make me co-host.
Yes.
You are the host now,
No
sir.
problem.
Actually, make me co-host. Then only I can share the screen, sir.
Yes, sir. You can. What I should do?
Sir, go to my name, sir. There, right, there.
Okay.
Just click on that. Three dots are there on that, and
Okay,
make
sir.
me as
Okay,
a
sir.
co-host, sir.
Yes, sir. Just a while, sir. Yeah. On the second screen. Okay. Just a while, sir. Yeah. Meanwhile, any doubts are there? People can ask. I'm just. Yeah. Yeah. Go to the three dots. Yeah, I have made it. I just released. Yeah. Ravichandra sir, you can take over as a host.
Sir, Ravichandar, sir, your audio is muted, sir.
Thank you, sir. Thank you. Sir, Roshan, sir, and also turn on your video, sir.
Yes, sir.
Thank you, Roshan, sir, for joining with this valedictory session also. And
yes, sir.
In this valedictory session, I would like to thank AICT for sponsoring this faculty development program on AI innovations in healthcare and medical technology. I thank to SR University Management and our Vice Chancellor, Professor Deepak Gai, Registrar, Dr. Akshan Reddy Garu, Dean, School of Engineering, Head of the Department, faculty members of various departments in the university, cooperating in conducting this event. And I thank my research scholars. And I also thank all the stakeholders as well as participants of this FDP, those who are actively involved in the sessions and share their views with the experts. I also thank to experts, those who are giving their wonderful sessions. Without experts, this is not possible. Thank you all for giving the excellent sessions. I thank participants once again for registering this FDP. In the near future, we will conduct more and more FDPs. We will try to collaborate and work together. The main aim of these FDPs are to share their knowledge and collaborations. So in that aspect, we can grow only as a professional person. Thank you all. Now I request participants to speak, share their views on this FDP. First, they have given some names, sir. So first, I would like to call Muhammad Faisal. Muhammad Faisal sir is there?
Yes, sir. Yes, sir. I'm available.
Please share your views for 1 minute, sir.
Good evening, sir. Hello.
You can speak, sir. We are listening. You speak, sir. Faisal sir. Next, Purni from Madam Purni. Niharika.
Yes, sir, I'm here.
Sir, my voice is audible, sir?
Yes, sir, your voice is audible. You speak, sir. No problem.
Okay, okay. Can I start, sir?
Yes, sir.
Okay, sir. Good evening, all. Thank you for giving the opportunity for giving the feedback. I would like to express my sincere appreciation for the opportunity to participate in the faculty development program organized by the SR University, sir. The sessions were well structured and covered both foundational concepts and cutting edge research in the field. An expert resource person allow us to gain practical knowledge and a deeper understanding of technologies in AI healthcare. And thank you once again for organizing such an enriching program, sir. Thank you so much for all the coordinators in SRU University. Okay, sir.
Next, Niharika. Next, Niharika.
Good afternoon, sir. Good afternoon, everyone. I would like to thankful to my supervisor Ravichandra sir and SR University for conducting this FDP. This FDP on AI inventions and healthcare and medical technology was highly impactful, covering diverse topics such as ECG signal processing, predictive analysis, and wearable devices, NLP in healthcare, geomics, and ethical challenges. The expert speakers with a vast experience delivered insightful sessions, blending academic depth and practical relevance. Thank you, sir. Thank you for this FDP. Thank you, everyone.
Next participant is next Srinath. Srinath is there. Next one is Shahina Kamrani. Shahina Kamrani. Farah Shan is there. So please unmute your mics, all of you. You can speak. Next, Ankush Verma. Am I audible?
Yes, sir, you are audible.
Yes, sir.
Yes. What about they have given names? Ankush Verma, Purima Shankar.
Good afternoon, all. Myself, Purnima Shankar. So, actually, this FDP session, the entire session for the week was actually knowledgeable, especially for the people working in the AI and healthcare domain. So, it has covered different views, the oldest as well as the latest technologies and trends in this particular domain. So, I once again thank this university as well as the resource persons who have provided us knowledgeable classes. Thank you.
Thank you. So those who are speaking, they can turn on their video. If they don't have any problem, please turn on your video. Next, P. Sindhuja. P. Sindhuja is there?
Yes, sir.
Yes. Please, if you don't have any problem, you otherwise you can. See, madam.
Good evening. Good evening, sir.
Good evening. Good evening. You just speak.
It is an honor to share a few words as we conduct this enriched faculty development program, AI Innovations in Healthcare and Medical Technology, organized by AICT, Atal Academic, and SRU University. Over the past days, we have gained invaluable insights into the how AI is resolving the health care from the innovative tools to address the ethical challenges. These sections were engaged throughout provoking and filled with the practical tech care that guide our future work. I extended my heartfelt gratitude to the organizers, coordinators, and speakers for their tireless efforts in making this program a success.
Thank you.
Thank you.
Next, Mohammad Faisal, already given.
Yes, sir, I completed.
Yes, sir. Shweta Kalavala. Shweta K. If possible, please turn on your videos, participants. Those who are giving you their valuable views, please turn on your videos. Okay. Next, Abhishek Tiwari. Abhishek Tiwari is there. Pooja.
Hello.
Yes. Please turn on your video, madam.
Sorry, sir.
Turn on your
Hello.
video. Video possible? Any Pooja?
Yeah, sir. Yeah.
If possible, turn on your video. Then we can have one.
Sorry, sir.
Okay, no problem. You speak, madam.
Yes. Good evening, everyone. I'm Pooja. I attended this FTP on starting onwards. This FTP covered various applications of AI related to healthcare and medical, like disease diagnosis using various signals and drug discovery, predictive analytics. It's more informative sessions. I learned a lot from this FTP. Thank you, sir, and thank you, SR University, for conducting Atal FTP on AI. Thank you, sir.
Thank you very much, madam. Next, Mohammed Afzal. Mohammed Afzal. Piyush Avtare. Piyush Avtare. Is there? Mohammed Afzal. Next, Asim Iqbal. Sir, you please speak, sir. Turn on your video, sir.
Good evening, sir.
Good evening.
So myself, Muhammad Asim Iqbal. So I thank organizers for organizing this wonderful program. I also thank all the speakers for sharing their workshop, their valuable information. I also found this workshop really helpful for those who have attended and who are doing their research in this area. I once again thank the SR University and all organizers for organizing such a wonderful workshop. And I expect in the future also more number of workshops you will be conducting, sir. Thank you. Thank you very much, sir.
Thank you very much, sir. Next, Vemula Niharika. Vemula Niharika. Srinivas Gaur. Rajshekhar K. Girdhar Babu, sir. Rajshekhar sir is there. Girdhar Babu. Lakshman.
Yes, sir. Good evening, sir.
Please share your views on your video.
Good evening, everyone.
Good evening. Good evening.
I'm very much sincere thankful to SR University for conducting such a wonderful FDP program associated with AICTE Atal Academy Faculty Development Program on AI innovations in healthcare and medical technology. As I am a research scholar of this SR University under the esteemed guidance of Dr. Professor Ravichandra sir, it is very much thankful to conducting this wonderful FTP program. I have learned so much things about this AI, which is associated with healthcare and medical trends. Whatever we are using this AI technology in medical emergency or medical biomedical technologies here. I'm very much thankful to ISR University as well as all the coordinators to arrange this wonderful FTP program. I'm interested to participate in the various such enriching knowledgeable FTP programs in future days also, sir. Thank you very much, sir.
Thank you, sir. Next, G. Srinivas Rao. Srinivas Rao Gorre.
Yeah. Good evening, sir.
Please turn on your video.
Yeah, sir. Can you see, sir?
Yes, sir. Okay.
Yeah. Good afternoon, everyone. The Atal FDP, which was conducted over the last few days, was very informative. And the best part of this is we are able to interact with so many esteemed persons or researchers in the same domain of healthcare and medical technologies. And as we know, AI is a recent technology which is happening like anything, and it is applicable for each and every field wherever it is possible. And how to use those skills for a particular field of, I can say, healthcare is being well explained throughout the sessions, sir. And I was able to attend most of the sessions, and it is very helpful to have sessions at 6 p.m. so that we don't have any problem with adjusting our classes, and we are able to learn many things out of this, sir. Thank you for the entire session, sir. And your session was very informative, sir. So thank you for everything you have done in the organizing such a wonderful event, sir. Thank you.
Thank you, Srinivas.
Okay, sir. Thank you, sir.
For giving your feedback. Next, Suganya. Suganya.
Sir, yes, sir.
Please turn on your video, madam, if possible. Otherwise, not issue.
Sir, can you hear, sir?
Yes, madam.
Yes, sir. First of all, I would like to thank our Professor Dr. Ravichandra, sir, for the organizing FDP on AI innovations in healthcare and medical technology, which provided us an insightful session on AI applications in EEG and ECG analysis, then predictive analytics, NLP, wearable devices, and genomics. Expert speakers delivered diverse, engaging content, adding hands-on workshops and extended session durations would enhance learning. Overall, it was a well-structured and impactful program. Thank you, sir.
Thank you very much, madam. Next, Billa Ramprasad Garu. Dr. Billa Ramprasad Garu is there. K. Saidul, sir.
Good evening, sir.
Please.
From Science Institute of Technology, Ibrahimpatnam, Hyderabad. So I would like to express my heartfelt gratitude for conducting an outstanding FDP on AI innovations in healthcare and medical technology. The program was exceptionally well organized, informative, and engaging, providing valuable insights into latest advancements in AI applications in healthcare and medical technology. Thanks for SR University for conducting such a wonderful FDP. Thank you, sir.
Okay. Okay. Thank you. Then who is that? Manjula. Dr. R. Manjula. Dr. Puriti Koteshwar Rao. Is there? Okay. Abdul Rahim Junaid.
Yes, sir. Good evening, sir.
Good evening, sir. Please give your valuable insights, sir. Just now you said was something which is Atal workshop. The feedback and test link was activated through Atal login.
Yes, sir. Yes, sir. Earlier, while I have attended, the rules was being changed, and the feedback and test link was through Atal portal only. So, like my query is it
That
like?
after this session, we will do that, sir. No problem.
Okay, sir. Sure, sir. So I thank SR University, sir, for conducting successful AI innovations in healthcare and medical technology, sir. It was a very useful workshop as I am into biotechnology field. So I have learned many new things related to healthcare technologies and like wearable devices which are there on the patients will improve. Patient health well in advance. So it was a good workshop, sir, and overall, best FDP I've attended through. So thank you very much, sir. Organizers, I thank organizers and management of SR University, sir. Thank you very much.
Okay. Next, any other participants? So you can freely, if any, some names are there, but they are not responding. Okay, now it is free, open to all. Anyone who want to give their views, they can share their views. Anand Girdhar sir, Srinivas Gaud sir, Ram Prasad sir, R. Manjula, Dr. R. Manjula, MD Abdul Rahim Junaid. Okay, just now over. Hanisara. Okay. Anybody want to give their feedback? Otherwise, we can close this session. So, sir, Junaid sir.
Yes, sir. Yes, sir.
What is the procedure, sir, for that? Earlier, test link activated through Atal login. So there that link
yes, sir.
is in the group.
That link everyone should log in through Atal and the link will be provided by the organizer, sir,
The
through that
same today or
FDP
tomorrow
Atal,
also
so
possible,
that
sir?
we could.
Okay, sir. Today or tomorrow also it is possible, sir?
I think tomorrow also it's possible, sir.
Okay. If possible, we will give today. Otherwise, tomorrow means we can. If not possible, tomorrow we will give, sir. Okay, sir. Thank you
Sure,
very
sir.
much, sir, for your giving this
Yes, sir.
update.
Welcome. Why? Because I have experienced earlier, sir. So we have written 2 tests. Like through earlier Excel sheet, they have provided the link. We have written the test successfully. Then again through Atal login also we have to write.
Okay,
Like it
okay,
was
sir.
a.
Thank you. Thank you, sir.
Okay.
Vishwanath Gaud, sir, the FDP was related to my PhD domain. So I think all your organizers, thank you, sir. Thank you. Once again, my heartfelt thank to Roshan Marty, sir, who is our active collaborator. Thank you very much, sir, your patience, listening, and for your wonderful session. Thank you very much, sir. In the sir also previously also have taken one session 2 years back in our AI FDP. Thank you very much. Thank you all the participants. Have a good day. We will share the links whatever there is. So please inform to all other participants also. Here actually registers are 130, but in this you have only 58. So inform to all other your friends also. Why? Because they should also get the certificate. Please inform to them also. Thank you very much. Thank you all. Roshan sir?
Thank you very much.
Roshan sir. Okay, I'm.
This meeting is being recorded.
Hello,
Okay,
sir.
sir.
Yeah.
Bye, sir. Thank you, sir. Thank you
Yeah.
very much, sir. Okay,
Yeah,
sir.
thank you very much, sir. Thank you
Okay,
all.
sir. Okay, sir. It's...
Okay, sir.